The heart monitor wasn't beeping anymore. It was screaming. At 2:47 in the morning, inside a locked ICU room at Stonebridge Memorial Hospital, a man covered in old scars and fresh sweat grabbed the attending physician by the collar and refused to let go. His grip was wrong for someone with a 104-degree fever, too controlled, too deliberate, like muscle memory overriding a body in collapse. "Get me Megan Calloway," he rasped. "Nobody else. You hear me? Nobody else touches me until you get her." The doctor yanked free, called security, filed a report. Nobody went to find Megan Calloway. That was their first mistake. Before we go any further, if you're new here, hit that subscribe button right now, because the story you're about to hear is exactly the kind that keeps you up at night. Real pressure, real stakes, real consequences. Drop a like if you're already hooked, and tell me in the comments, what city and country are you watching from? I want to see how far this story travels. Now, let's go back to the beginning. Megan Calloway was 29 years old and had been on her feet for 11 hours when her pager buzzed. She was in the supply corridor on the 3rd floor, restocking wound dressing kits onto a rolling cart, her sneakers squeaking faintly against linoleum that hadn't been replaced since before she started working here. The corridor smelled like industrial bleach and something older underneath, the institutional smell of a building that had absorbed decades of bad news. Stonebridge Memorial sat at the edge of Harlow, a mid-sized city in the flatter part of the state, the kind of city where the hospitals weren't the best, but they weren't the worst, and everyone pretended that was good enough. The pager read, "Report to ICU 7. Patient requesting nursing reassignment." She looked at it for a second, then clipped it back to her waistband and kept moving. ICU requests at this hour were usually a misunderstanding or a drunk patient or a family member causing problems. She'd learned not to sprint toward trouble that might dissolve on its own. She was wrong about this one. ICU 7 was on the far end of the 4th floor, separated from the rest of the unit by a frosted glass partition and a keypad door. When Megan pushed through, she found 2 security officers and a charge nurse named Paula Reese standing outside the room, arms crossed, talking in the clipped shorthand people use when they're trying to look calmer than they are. "Calloway," Paula said, catching her eye. "He's been asking for you by name for 20 minutes. Dr. Alderman already tried to go in twice. Patient wouldn't let him get within 4 feet of the bed." Megan stopped. "Who is he?" "Name on the chart is Damon Walsh, 36. Admitted 6 hours ago through the ER, severe systemic infection, elevated white count, the works. Transferred up here when his pressure dropped." "Why does he know my name?" Paula's mouth tightened. "No idea. But Dr. Alderman wants him sedated if he won't cooperate, and that requires someone getting close enough to do it. We thought maybe if you want me to go in so you can sedate him against his will." Paula didn't answer, which was its own kind of answer. Megan looked through the narrow window set into the door. The man inside was sitting half upright in the hospital bed, which already told her something. Patients with a pressure drop that's severe usually didn't have the strength to sit. I was broad through the shoulders, the kind of build that didn't come from a gym but from work. The tendons in his forearms visible even from here, standing out against skin that had gone pale and waxy with fever. He had a network of old scars on his left arm, the kind that didn't come from accidents. His eyes were open and tracking the door. He saw her face in the window. Something shifted in his expression, not relief exactly, more like recognition, like he'd been waiting and was angry it had taken this long. She went in. The room smelled wrong immediately. She clocked it before she consciously identified it. A faint chemical sharpness underneath the antiseptic, something that didn't belong. She'd smelled something like it before, years ago, in a different context entirely. She filed it away and kept her face neutral. "Mr. Walsh," she said, "I'm Megan Calloway. I heard you wanted to speak with me." "Shut the door," he said. His voice was rough, stripped down, but the cadence was measured. Even sick, even burning up, he was choosing every word. She pushed the door closed behind her. Through the glass, she could see Paula and the security guards watching. "You don't remember me," he said. It wasn't a question. "I don't," she admitted. "Should I?" "Harlow General, 4 years ago, ER, night shift. Some doctor was about to push a double dose of heparin into a post-op patient who'd already been given thinners 2 hours earlier. You caught it. pulled the syringe out of his hand in front of 3 other staff members, and told him he was going to kill the patient. Megan was quiet. She did remember that. She remembered it very well, because the doctor had filed a complaint against her the following morning, and she'd spent 2 weeks in meetings with hospital administration defending herself before they ultimately ruled in her favor. "You lost a shift rotation over it," Walsh said. "I was in the next bay. My buddy was the post-op patient. His name was Terrence. He's alive because of what you did." She looked at him steadily. "That was a long time ago." "Yeah," he said, "and I kept track." He shifted against the pillows and winced, a real wince, the involuntary kind, not performance. "I need you to listen to me carefully. The medication they've been giving me since I came in tonight, it's wrong." "In what way?" "I've been on a course of Ceftix 4 for the past 3 weeks, prescribed by a VA doctor in Kellerton. The antibiotic they pushed in my IV an hour ago didn't hit the same way. The timing was off. The reaction was off. And the packaging on the bag had a label with a font I've never seen on a hospital medication in 12 years of dealing with hospital medications." He held her gaze. "I know what my medication feels like when it works." That wasn't it. Megan kept her expression even, but something moved in the back of her mind. A low, careful attention, the kind she hadn't needed to use in years. "You have a specific medical history with this antibiotic." "Documented. In my chart. The VA records should have transferred." "I'll pull them." "Don't tell Alderman you're pulling them." She studied him. "You think Dr. Alderman is involved in something?" Walsh didn't answer directly. "I think there are things happening in this building that go well beyond one careless doctor. I think you're the only person in this hospital who's been proven to look at the patient instead of the clipboard. And I think if you pull my VA records and compare them to what's in this chart and what was in that IV bag, you're going to find something that makes you very uncomfortable." A knock at the glass. Dr. Alderman's face appeared in the window. Mid-50s, silver-haired, the kind of handsome that had curdled slightly with years of institutional authority. He held up his hands in a "what's the status" gesture. Megan raised one finger. "1 more minute." Alderman's expression didn't change, but his jaw tightened. She turned back to Walsh. "What happened to you? Medically? Before tonight?" He was quiet for a moment, deciding how much to give her. "I was in Kolvar province in 16. IED. My team got hit. I had a perforated bowel, 2 broken ribs, shrapnel in my left shoulder that they never fully removed. The shoulder is what keeps getting infected. I've been in and out of 3 hospitals in the past 8 months. This one was supposed to be the closest VA-affiliated facility when the fever spiked tonight." He paused. "I didn't choose to come here." "Your transfer records from the other facilities, are they in your chart?" "They should be." She reached for the tablet on the wall mount and pulled up his file. The VA records were there, a compressed transfer summary, 3 pages. She scanned them fast, the way she'd learned to scan things when there wasn't time to read carefully, her eyes catching the important numbers. His documented antibiotic protocol, his documented reaction history, his baseline vitals under infection conditions. She looked at the IV bag hanging beside his bed. Then she looked again. The bag was labeled CFTX4 concentrate, 500 ml, 100 ml, which was correct. The lot number printed on the label was a standard format. The expiration date was in range. But the font on the lot number was slightly heavier than the rest of the label text. The kind of inconsistency you'd only notice if you'd spent years reading medication labels in bad lighting on zero sleep, which she had. It might be nothing. Label printers had calibration issues, batches varied, or it might not be nothing. She unhooked the bag from the IV stand and turned it over in her hands. The seal at the connection port was intact. The fluid inside was the right color, pale straw, clear, no particulate. But the weight was slightly off, and she couldn't have explained in a court of law how she knew that, except that she'd carried enough medication bags through enough difficult situations that the difference in density registered somewhere in her hands before her brain caught up. She rehung the bag. "I'm going to pull your complete record," she told Walsh, "and I'm going to look at the pharmacy documentation on this lot number. If something's wrong, I'll find it. And if someone tells you to drop it, then I'll have to make a decision." He looked at her for a long moment. Something in his face settled, not into trust exactly, but into a kind of wary acceptance. Fair enough. She walked out of the room. Alderman was on her immediately. What took so long? What's his status? Stable for now. He's agreed to continued monitoring. She kept her voice flat, professional. I want to review his full pharmacy documentation before we adjust his antibiotic dosing. His VA records indicate some interaction sensitivities I want to cross-reference. Carter already reviewed his chart. Calloway, she said. Alderman blinked. What? My name is Calloway. You've called me Carter twice tonight. A short, irritated pause. Calloway. Carter already reviewed his chart when he came in. It's straightforward. The dosing is appropriate. Who is Carter? Night pharmacist. Look, we don't need a nurse second-guessing a pharmacist's work at 3 in the morning. Walsh is unstable and uncooperative, and if we can't get his fever down in the next 4 hours, he's going to… Then give me 30 minutes to do a proper cross-reference, Megan said. If it checks out, I'll report back and we proceed. If I find something, you want to know before it becomes a problem. She made it sound like she was protecting him. People like Alderman always responded better to being protected than being questioned. 30 minutes. He looked at her like she was mildly annoying and not worth the argument. Fine. 30 minutes. And then we're having a real conversation about patient management protocols. She walked away before he could add anything. The hospital pharmacy at Stonebridge Memorial was on the second floor, accessible by a staff elevator that required a badge and a 4-digit code. Megan had worked here long enough to have memorized the access codes for every floor, not through any special effort, just through the accumulated knowledge of 3 years of moving through a building for 12 hours at a stretch. She badged in at 3:14 a.m. The night pharmacist, Carter, apparently, wasn't at the dispensing window. The outer room was empty, lit by the overhead fluorescents and a desk lamp left burning over a workstation with a half-finished cup of coffee going cold. The coffee was still faintly steaming, which meant he'd stepped away recently. She moved to the workstation and pulled up the dispensing log for ICU 7. Walsh's antibiotic order had been filled at 11:58 p.m., lot number 7734A. The lot had been received in a shipment dated 3 days ago from a distributor called Meridian Pharma Solutions, which wasn't a name she recognized from the hospital's usual suppliers. She cross-checked against the supplier registry on the system. Meridian Pharma Solutions was listed, but the listing had been added to the registry 6 months ago, and the authorized signature on the vendor approval form was one she couldn't immediately place. She photographed the screen with her personal phone. Against protocol. She did it anyway. The dispensing log showed 16 other ICU patients had received medications from the same shipment in the past 3 days, all of them on military-connected insurance plans, VA benefits, TRICARE, CHARM, active duty dependent coverage. Every single one. She stood very still in the empty pharmacy and let that fact settle into her. It might still be coincidence. Shipping batches weren't selective. Maybe the military patients had simply been admitted during the window when that particular shipment was being used. But 16 out of 16 was a very specific coincidence. She was still staring at the screen when she heard the door behind her click open. She turned. The man in the doorway wasn't a pharmacist. He was wearing a suit at 3 in the morning, which in a hospital meant either administration or law enforcement, and he was too relaxed for law enforcement. He was around 50, heavy-set in the way that comes from authority rather than indolence, with a face that had probably been affable once and had since learned better. His eyes went from her to the workstation screen to her phone and then back to her face, and the sequence of that look told her something important about what he'd assessed in those 2 seconds. "Nurse Calloway," he said. She didn't ask how he knew her name. That would have been the wrong move. "The pharmacy is a restricted area," she said. "I have authorization to access dispensing records for my patients." "Of course you do." He stepped inside and let the door close behind him. "I'm Richard Voss. I'm the Executive Director of Clinical Operations here at Stonebridge." He said it the way people say titles when the title is meant to end a conversation. "It's a little late to be doing records review. My patient's in the ICU. It's always late when something needs to be checked." Voss smiled, and it was the kind of smile that contained no warmth. "Right. Damon Walsh. I heard he was giving the staff some trouble." He walked to the dispensing window with the ease of a man who was used to walking into rooms and having them rearrange around him. "Here's the thing about Mr. Walsh, and I say this with complete respect for your clinical diligence. He has a documented history of paranoia related to his service injuries. PTSD-adjacent presentation, very common in his cohort. The VA records reflect that. You'd have seen it if you'd read the full psychological addendum. Megan kept her face neutral. I'll make sure to review that section. Good. Voss picked up a pen from the counter, turned it in his fingers. The medication he received tonight is correct and properly sourced. Any discrepancies you think you're seeing are artifact of a new labeling system. Our current distributor switched to last quarter. It threw a few people off initially. He set the pen down. I don't want you spending the rest of your shift chasing ghosts, Nurse Calloway. Your patient needs care, not an audit. Everything he was saying was plausible. Each individual piece of it could be true. And he had arrived here, in this room, at 3:15 in the morning, within minutes of her accessing those records, without being called. Of course, she said. I appreciate the context. I'll head back up. She pocketed her phone and walked to the door. Voss didn't move to stop her. He just watched her go with that same flat, patient expression, and she felt his eyes on the back of her neck all the way down the corridor. She did not go back upstairs. She went to the stairwell, took the stairs to the basement level, and stood in the utility corridor for 90 seconds, doing nothing but thinking. The basement of Stonebridge Memorial was technically a restricted area. Mechanical systems, storage, old records. But she had a plausible reason to be down here if anyone asked. She was looking for a specific piece of patient documentation that had been misfiled. It was the kind of explanation that was boring enough to be believed. The storage wing ran the length of the north end of the basement, sealed by a heavy door with a standard electronic lock. Her badge shouldn't have opened it. This area was beyond her clearance level. She tried it anyway. The door beeped green, which meant someone hadn't updated the access permissions properly, or someone had added her badge to this area by mistake, or someone wanted this area accessible to floor staff without leaving a specific trail. The third option was the most interesting and the most frightening. She pushed through. The storage wing was climate-controlled and smelled of cold plastic. The overhead lights were motion-activated and came on in sections as she moved deeper inside. Standard pharmaceutical cold storage units lined the left wall, the kind used for vaccines and temperature-sensitive medications. Nothing unusual there. But against the far wall, stacked on industrial pallets, were crates she didn't recognize. No hospital branding, no standard pharmaceutical shipping labels. The crates were sealed with industrial zip ties and printed with a manifest number, a shipping origin, and a single line of destination text. Meridian Pharma Solutions, receiving hold. She counted 12 crates on the near pallet alone. She found a seam on one that had been opened and resealed imperfectly. She worked it apart with her thumbnail. Inside were sealed medication packages, the same format as the IV bags she'd seen in Walsh's room. Same labeling system, same lot number series. But these weren't filled with pale straw antibiotic solution. She picked one up and held it against the light. The fluid inside was slightly different, not different enough to catch at a glance. Different enough to catch if you were looking for it, which she was. She set it down carefully. Her hands were steady. She was aware, with a clarity that felt almost physical, that she was standing in the middle of something that was going to change the shape of everything that came next. And she hadn't chosen to be here, hadn't asked for this, had simply followed one thread because a patient asked her to look at the patient. She took out her phone and began documenting. She photographed the crates, the manifest numbers, the shipping labels, the open package and its contents. She photographed the cold storage units on the opposite wall, which upon closer inspection also contained packages from the same lot series, some of them already broken down into individual doses and labeled for specific patients. 16 patients. All military insurance covered, all receiving medications from this shipment. She thought about Walsh upstairs with his fever and his army-trained grip, and the look in his eyes when he said, "You were the only one who looked at the patient." She thought about Voss in the pharmacy with his plausible explanations and his 3 a.m. suit and his flat patient eyes. She sent the photos to an email address she hadn't used in 3 years, an encrypted personal account she'd set up during her army days out of a habit of excessive caution that had seemed paranoid at the time. The email went through. She felt the faint buzz of the send confirmation and pocketed the phone. Then she heard footsteps, not one set, two. Coming from the direction of the main door, moving with purpose, not the idle shuffle of maintenance staff. She killed her flashlight, dropped behind the nearest pallet, and went completely still. The skills came back without any particular effort, The way breathing comes back. Keep low. Minimize profile. Control your breathing rate. The fluorescent lights had clicked off when she stopped moving. The door opened. Light flooded in from the corridor, then dimmed as the door swung mostly shut. Two voices. One she recognized as Voss. The other was new, male, younger, clipped, and businesslike. She accessed the dispensing log, the second voice said. Full lot records for the past 3 days. I spoke with her, Voss said. She bought it. Did she? A pause. She's a night shift nurse, Marcus, not an investigator. Dr. Hale wants the remaining inventory moved up by 48 hours. The DoD audit schedule was bumped. The transport is already arranged. The Kellerton shipment goes out Thursday morning. And Walsh? Another pause, longer. Walsh is a problem. He's been asking questions since he came in, and now he's specifically requested this particular nurse, which means he came in with the target in mind. So sedate him, Marcus said. Alderman already flagged him as non-cooperative. That's not a long-term solution. If Walsh has contacts, and he does, his file is flagged at a federal level, then his condition deteriorating in our care creates a liability we can't. His condition isn't going to deteriorate, Marcus said flatly. It's going to resolve, one way or the other. Silence. Megan's phone was in her pocket. She did not move. She did not breathe in any way that was audible. She had spent 14 months in places where the cost of being heard was something she didn't think about anymore because thinking about it didn't help anything. Get the nurse's file, Voss said finally. I want to know everything she's had access to tonight. Every badge swipe, every system login. Already on it. The footsteps moved toward the far end of the storage wing. She heard a key in a lock, an actual physical key, which meant there was a secondary space in here she hadn't reached yet. She waited. 3 minutes. 4. She heard the secondary door close, and then she heard nothing. She moved. Not toward the exit, toward the secondary door. It was old. A standard keyed lock, the kind that had been here since the building's original construction, not updated with the electronic system the rest of the basement used. The gap at the bottom was wider than standard. She lowered herself to the floor, pressed her cheek against the cold concrete, and looked through. The room beyond was larger than she'd expected. Better lit. And it was not a storage room. It was a staging area. Shelving units ran the full perimeter. Every shelf was packed with medication packaging, hospital-formatted IV bags, sealed blister packs, labeled vials, all with that same consistent labeling she'd identified on Walsh's drip bag. At the center of the room, a folding table had been set up as a workstation with a laptop, a label printer, and a scale. Voss was standing with his back to her, talking on a phone. Marcus, she could only see his shoes and the lower quarter of his suit, was logging something into the laptop. The shelving directly across from her eye-level held packages labeled with VA-specific pharmaceutical codes. She counted the rows, 6 deep, 10 across, multiple layers on each shelf. This wasn't a theft of opportunities situation. This wasn't a single corrupt pharmacist skimming product. The scale of what she was looking at, the organization of it, the staging, the specific targeting of military insurance-funded patients, was an operation. Something that had been running for months at minimum, probably longer. And it was running right here, inside a hospital that was supposed to be healing people. She pulled back from the door, got to her feet, walked back through the storage wing with quiet, precise steps, let herself out through the main door, and stood in the utility corridor for exactly long enough to confirm no one was in the hallway. Then she walked to the stairwell and went back upstairs. She had 47 photographs on her phone. She had the email confirmation to her encrypted account. She had the testimony of a patient who had specifically sought her out because he'd watched her do the right thing once before. And she had the growing certainty that the man in ICU 7 was not paranoid. He was the only person in this building who had correctly identified what was happening, and the people running this operation knew it, and they had just in the basement 2 floors below where he was fighting a fever with medication that was not what it claimed to be, discussed his future in the same tone you use when you're deciding whether a problem needs to be managed or eliminated. She pushed through the stairwell door onto the 4th floor. Paula Reese was at the nurse's station. She looked up when Megan came through. Alderman's been asking where you are. Tell him I'm with my patient, Megan said. And Paula, I need you to pull the full visiting log for ICU 7 for the past 12 hours, and hold it for me. Don't file it into the system yet. Just hold it. Paula frowned. Why? Because I need to know who's been in that room, Megan said, and I need a record of it that doesn't pass through the main administrative system tonight. Paula looked at her for a long moment. She was 10 years older than Megan, had been at Stonebridge twice as long, had the permanent skeptical squint of someone who had learned that unusual requests at unusual hours usually meant someone's problem was about to become everyone's problem. I'm not going to ask what this is about, Paula said. That's probably smart. But if you're doing what I think you might be doing, Paula stopped, seemed to make a decision. You should know that Carter, the night pharmacist, called in sick 2 hours ago. Someone from administration came down and covered the dispensing window personally. That's the first time I've seen that in 11 years. Megan took that in. Who from administration? Voss, Paula said. Richard Voss. The name sat between them in the fluorescent quiet of the nurses' station, and Paula didn't say anything else, and Megan didn't either, because there wasn't anything left to say that the silence hadn't already covered. Megan pushed off the desk and walked toward ICU 7. Walsh was still upright in the bed. His fever hadn't broken. His color was worse than it had been 40 minutes ago, the flush of fever going deeper, the waxy undertone more pronounced. But his eyes were clear, which meant whatever was in that IV bag, it hadn't been enough to fog him. She closed the door behind her and spoke quietly and quickly. I went to the pharmacy. I went to the basement. I have documentation. She held up her phone for a second, then pocketed it. Your medication lot number traces to a distributor called Meridian Pharma Solutions. 16 ICU patients in the past 3 days, all on military-connected insurance, all receiving from the same shipment. There's a staging area in the basement that is not a storage room. She paused. You were right. Walsh said nothing for a moment. His jaw worked once. How much did you see? Enough. Okay. He closed his eyes briefly. When he opened them, something had sharpened behind the fever glaze, not calm exactly, but resolve. The same quality she'd seen in people who had been in bad situations before and had learned to function inside them. There's a number in my left shoe. A contact, not military, federal, DOJ connected. I've been building a file on Stonebridge for the past 6 weeks. I wasn't just randomly admitted here tonight. He met her eyes. I was trying to get inside the building. I needed someone on staff to confirm what I couldn't access from the outside. Megan stared at him. You're not just a patient, she said slowly. I'm also a patient, he said. The infection is real. The fever is real. But yes, I came in through the ER because I needed a legitimate admission and I needed to identify someone on staff who could move through this building without raising flags. His mouth tightened. I'm sorry I didn't tell you the full picture up front. I needed to know you'd look because you actually saw something, not because someone told you to. Megan's hands were very still at her sides. She thought about Voss in the pharmacy, Marcus in the basement. The conversation she'd pressed herself against cold concrete to overhear, and the specific way Voss had said one way or the other about the man in this bed. She thought about 11 hours on her feet, and a pager buzz, and a patient who asked for her specifically because 4 years ago, in a different hospital, she had chosen to look at the patient. The shoe, she said. Left or right? Left. She reached down and pulled out a folded piece of paper with a phone number written in small, precise handwriting. If something happens before you can make that call, Walsh said, my contact's name is Reeves. He'll know what it means if you say the name Meridian. She pocketed the paper. Nothing's going to happen, she said, because I'm going to fix your medication first. She reached past him and unhooked the IV bag from the stand. She was reaching for the replacement line when the door opened behind her. Dr. Alderman stood in the doorway. Behind him was Richard Voss, and Voss was holding a printed document that she recognized, with a stomach drop that was almost physical, as a printed screenshot of the dispensing log she had accessed 40 minutes ago, with her badge ID highlighted in a red box at the top of the page. His expression was the same one he'd worn in the pharmacy. Patient, flat, and no longer even slightly warm. Nurse Calloway, Voss said, I think we need to have a conversation about what you've been doing tonight. Megan didn't move. That was the first thing. The stillness. Not the frozen stillness of someone caught, but the deliberate stillness of someone deciding. It lasted maybe 2 seconds, which felt much longer. And in those 2 seconds, she took in the full picture. Alderman in the doorway with his arms crossed and his silver hair and the expression of a man who had been waiting for a reason to be right about her. Voss behind him with the printed screenshot and the flat patience of someone who had done this before. Confronted someone who'd gotten too close to something, walked them back, closed the door. The IV bag was in her hand. She set it down on the bedside table, calmly. Not hiding it, not drawing attention to it, just setting it down. "Mr. Voss," she said, "I was just coming to find you." That landed wrong, which was exactly what she needed. Voss's eyes narrowed a fraction. The micro-expression of someone whose prepared script just lost its opening line. "Were you?" he said. "I had concerns about a medication lot that I wanted to flag through proper administrative channels. I was going to document my observations and bring them to you directly, since you indicated earlier that you were the appropriate point of contact for supply chain questions." She kept her voice professional, a little tired, the way someone sounds when they've been working an 11-hour shift and are doing their due diligence and would really like to sit down. "I'm glad you came up. It saves me a trip." Alderman looked at Voss. Voss looked at Megan. Walsh from the bed looked at the ceiling, which was probably the smartest thing anyone in the room was doing. "The printout," Voss said, holding it up slightly. "You accessed records you don't have authorization for." "The dispensing log for my patient's medication? I have full authorization to review that. It's within my scope of practice for medication reconciliation." "The extended lot record, the supplier documentation." "Part of the same review." She tilted her head just slightly. "Dr. Alderman, you authorized me 30 minutes ago to do a cross-reference on Mr. Walsh's medication history. I was doing exactly that. If there's a concern about which specific records I accessed, I'm happy to go through it with you both in the compliance office in the morning." She paused. "Is there a concern?" Alderman shifted his weight. He didn't like this. She could see that. He'd come up here expecting to find her defensive, maybe tearful, certainly off balance, and instead she was standing in a patient's room with the calm, specific energy of someone who had already prepared for this conversation and found it less scary than expected. "Your patient needs care," Alderman said finally. "Not an investigation." "Agreed," Megan said, "which is why I'd like to adjust his IV line to a documented alternative protocol while the lot number question gets sorted out. Standard procedure when there's any labeling irregularity flagged during review." She looked at him directly. "Unless you'd prefer to document that I raised a labeling concern and you instructed me to proceed without reviewing it, I can note that in the chart either way." A silence that was almost textural. Alderman's jaw was tight. He was doing the math. A nurse who was asking him to put something in writing was a nurse who had already thought about what happened when it wasn't in writing. "Do the adjustment," he said, clipped. "Document it properly." "Of course." She looked at Voss. "I'll have the compliance memo on the lot question on your desk by morning." Voss looked at her for a long moment. Then he folded the printed screenshot once, precisely, and tucked it into his jacket pocket. "I'll look forward to it," he said, in the tone of a man who would not. They left. Megan waited until she heard their footsteps move past the glass partition and down the hall. Then she exhaled through her nose, quiet, controlled, and picked up the IV bag from the bedside table. "That was impressive," Walsh said from the bed. "Don't," she said. "I need to think." She disconnected the existing IV line, capped it, and reached into the supply cabinet in the corner of the room. The hospital stocked emergency backup supplies in every ICU room, part of the disaster protocol, rotated regularly. She found a sealed bag of broad-spectrum antibiotic solution from a different supplier, a manufacturer she recognized, a lot number she could trace in 2 minutes with the system access she already had. She checked the seal. Intact. She checked the label under the room light. Consistent font, consistent printing, correct weight in her hand. She connected the new line. Walsh watched her work without speaking, which she appreciated. She wasn't in the mood to be thanked or managed. "The number in your shoe," she said while she adjusted the drip rate. "Reeves. DOJ connected. What does that actually mean?" "It means he works for an office that investigates fraud against the federal government, specifically defense contractor and VA system fraud." Walsh shifted against the pillow. "Meridian Pharma Solutions has been on their radar for 14 months. The problem was always documentation. The operation was compartmentalized, distributed, never enough in one place to build a case. Stonebridge was the hub, the staging point. We knew that. We couldn't prove it. Until tonight. Until you went into that basement, yeah. She taped the new IV line to the back of his hand and straightened. When you say we, who's we? He hesitated. Walsh. I was asked to make contact with this facility under a federal assistance protocol. I'm not active duty. I'm a civilian contractor with a security clearance and a legitimate medical history that made the ER admission credible. The infection is real. Everything in my chart is accurate. He met her eyes. I wasn't sent here to put you in danger. And yet, she said. And yet, he agreed. He had the grace to look like he meant it. She pulled up a chair, turned it backward, sat with her arms folded over the back. Voss is going to pull every system access record I have from tonight. He's going to know exactly what I saw. If the photo evidence I sent to my personal account is the only documentation outside this building, that's not enough. Encrypted personal email doesn't open a federal investigation. It's background noise. Reeves needs the physical evidence, the crates in the staging area, the label printer, the scale, the laptop. That room needs to be on record with a chain of custody before they move the inventory. They said Thursday morning, the Kellerton shipment. Walsh went very still. They said that? Those words? Voss and someone named Marcus. In the basement, when I was... She stopped, looked at him. You know who Marcus is. Marcus DeVere. He's the distribution coordinator for Meridian. If he's physically on site, it means the operation is further along than Reeves estimated. He tried to push himself upright and winced hard, the fever catching up with the adrenaline. I need to make that call. Your phone? They took it when I was admitted. Standard intake procedure, which I expected. That's why the paper. She pulled out the number, looked at it. The digits were written in pencil, faint, in the small handwriting of someone trained to take up as little space as possible. If I use my phone, they can trace the call to me. Use the room landline, call the number, ask for Reeves, say Meridian and give him the location. He'll take it from there. And then what happens to me? Walsh looked at her steadily. That depends on how fast Reeves can move and how fast Voss figures out how much you actually saw. It wasn't reassurance. She hadn't asked for reassurance. She'd asked a direct question and he'd given her a direct answer, and she found she respected that more than comfort would have been. She stood up, picked up the room landline, and dialed. It rang 4 times. Then a voice, male, mid-40s, the flattened vowels of someone from somewhere in the middle of the country. Yeah. I need to speak with Reeves, she said. I'm calling about Meridian. I'm at Stonebridge Memorial in Harlow. There's a staging area in the basement, north storage wing. It needs to be on record before Thursday morning. A pause. Who am I speaking with? A nurse who went where she wasn't supposed to go tonight and saw things that can't be unseen. Another pause, shorter. Is Walsh with you? He's the reason I'm calling. Stay in the building. Don't discuss this on any hospital system. I need a number to reach you that isn't internal. She gave him her personal cell. Someone will contact you within the hour, Reeves said. Don't do anything else tonight. Don't go back to that basement. He hung up. She set down the handset and looked at Walsh. He read her face. He's moving, Walsh said. He said within an hour. That's fast. That means he already had people staged. He leaned his head back against the pillow, and she watched some of the tension go out of him. Not all of it, but some. The fever was still there, but the new line was running clean, and his color had stopped getting worse. You should go do your rounds. Act normal. Don't give Voss a reason to move up the timeline. I'm aware, she said. I know you are. She pushed the chair back against the wall, checked his monitor readings one more time, oxygen saturation holding, heart rate elevated but not spiking, blood pressure climbing back toward acceptable, and walked to the door. Calloway. She looked back. Whatever happens next, you did the right thing. I know that doesn't make it easier. No, she said. It really doesn't. She went back to her rounds. The next 40 minutes were the strangest of her professional life, which was saying something, given that she'd done 14 months in a forward operating base where strange had a very specific and very permanent meaning. She checked vitals. She updated charts. She responded to a call light from a patient in ICU 3 who needed water and a repositioning. She smiled at Paula when Paula asked if everything was okay and said yes, and meant it about as much as she meant anything at that hour on zero sleep with a federal fraud operation running in the basement below her feet. She was in the medication room on the 4th floor when her personal phone buzzed. Unknown number. She stepped into the corridor, checked both ends, and answered. Calloway? Not a question. A woman's voice, sharp, professional, the specific economy of someone who talked this way all the time and didn't notice anymore. Yes. My name is Instructor Falk. I'm with the Office of Inspector General, Federal Contract Division. Reeves forwarded your contact. I need you to verify 2 things. The staging area you accessed. Was the door locked with a physical key or electronic? Physical key. Old lock. Separate from the electronic system covering the rest of the basement. And the inventory. You said crates. How many pallets? At least 2 that I could see. I couldn't access the secondary room, but through the gap at the bottom of the door I saw shelving on all 4 walls. Falk was quiet for a moment. She could hear keyboard sounds in the background. We have a team in Harlow. They've been on standby for 6 days waiting for inside confirmation. What you sent to your encrypted account. We received copies through Walsh's relay protocol. Megan blinked. Walsh's relay protocol? Your encrypted account was flagged as a secure channel through his operational file. The photos went to us simultaneously when you hit send. You didn't know that. No, she said slowly. I didn't. I apologize for that. Walsh's authorization level didn't require full disclosure to civilian contacts. A pause that might have contained something like discomfort. You've been more useful than we anticipated. That's one way to put it. She kept her voice level. What happens now? Our team needs 4 to 6 hours to execute a proper entry and evidence preservation. We cannot move tonight without risking the chain of custody. The Thursday timeline Walsh gave you. We believe that's accurate, which means we have until Wednesday night at the latest. Voss knows I was in the basement. He doesn't know how much I saw, but he knows I accessed the dispensing records, and he's going to pull my full badge log tonight. By morning, he'll know I went to the basement level. Understood. We need you to remain in the building and operational until we can move. If you're suspended or removed from the premises, our inside confirmation goes with you. She pressed 2 fingers against her forehead. You want me to act like nothing happened. We want you to act like a nurse who raised a routine labeling concern, was appropriately spoken to by administration, and is now continuing her shift. While Voss decides whether I'm a problem. Yes. The word landed with the particular bluntness of someone who wasn't going to insult her by dressing it up. If he moves to suspend me before your team comes in, contact Walsh through the room landline. He has a secondary protocol. And if they decide Walsh is the more immediate problem, a beat. We have eyes on that room. Trust the process, Calloway. She almost laughed, which wasn't funny. All right, she said. All right. The call ended. She stood in the 4th floor corridor with her phone in her hand and the night pressing against the windows at the end of the hall, and thought about how she'd been 11 hours into a shift when her pager buzzed, and how she'd told herself it was probably nothing. She went back to the nurse's station and sat down and started typing chart notes, because that was what you did when you were trying to look like nothing had happened. Paula was at the other end of the desk, working through her own documentation, and she didn't ask any questions, and Megan didn't volunteer anything, and they worked in the specific quiet of 2 people who understand each other well enough to know when not to talk. It was 4:40 a.m. when Alderman came back. He walked to the station with the deliberate pace of someone who had been on the phone and had come to a conclusion. He stopped across the desk from Megan and put both palms flat on the surface, which was the posture of someone who wanted to look commanding but had run out of actual commands. There's going to be a review of tonight's access records, he said. Pending that review, I'm recommending you finish this shift and not pick up your next scheduled rotation until the compliance office has cleared your documentation. Megan looked up from the chart. You're suspending me. I'm recommending a review period. It's administrative. It's not disciplinary. Dr. Alderman, I raised a medication labeling concern for a patient in my care. If the review finds that my concern was unfounded, I'll accept that outcome. If it finds that the concern was valid, the concern has been addressed by Mr. Voss and the supply chain team, Alderman said, and his voice had gotten quieter, which with him meant more brittle. There is no ongoing issue. Then the review should be straightforward. He looked at her for a long moment. He wasn't a stupid man. She'd never thought he was. He was a man who had decided, at some point in his career, that the institution was worth more than the inconvenience of individual questions, and had rebuilt his professional identity around that decision. Looking at him now, she thought she could see the exact moment he'd made that choice, preserved in amber somewhere behind his eyes. "Finish your shift," he said. "Document everything by the book, and then go home." He walked away. Paula waited until he was through the partition door. "Review period," she said, without looking up from her screen. "Yeah. First time I've seen Voss come up here twice in one night in 11 years, and now a review period." Paula typed something. "Calloway." "Yeah." "Whatever you found tonight." Paula stopped, started again. "My nephew did 2 tours, got out with a medical discharge and a VA prescription he can't always get filled. I'm just saying." She kept typing. "I'm just saying that." Megan looked at the side of Paula's face, the set of her jaw, the deliberate focus on the screen. "I hear you," she said quietly. The next hour and a half moved in the strange, slowed-down way that hours move when you're waiting for something and trying not to look like you're waiting. She did her rounds. She updated charts. She went back to Walsh's room at 5:15 and found his fever had dropped 0.5 degree, still high, but moving in the right direction, which meant the clean medication was working. He was half asleep when she came in, but he opened his eyes when she checked his line. "Falk called me," she said, low enough that it didn't carry past the bed. "I know. She told me." He watched her adjust the drip. "You doing okay?" "Alderman's putting me on a review hold. I'm done after this shift." That was faster than I expected. "Voss doesn't waste time." She straightened. "Your people have until Wednesday night." "They'll make it." He said it with the same certainty she'd heard in him from the beginning. Not bravado, but the specific confidence of someone who has worked with competent people before and has learned to trust the process even when the process is uncomfortable. Reeves doesn't move until he knows he'll win. "That must be nice," she said, and meant it without any particular edge. She was back at the station, 40 minutes from the end of her shift, when her phone buzzed again. Not a call this time. A text from the same unknown number as Falk. "Check your hospital email. Don't open on hospital system. Forward to your personal account first." She looked at the message. Forwarding internal hospital email to a personal account was explicitly against Stonebridge Memorial's data policy. She had already violated 3 different access protocols tonight and was currently on a review hold that would probably become a suspension before she made it home. She forwarded the email. It opened on her phone 60 seconds later. It was from a generic internal administrative address, the kind used for mass notifications. But the content wasn't a mass notification. It was a single-page document, a memo dated 6 months ago, signed by both Dr. Alderman and Richard Voss, authorizing a pilot program for alternative pharmaceutical sourcing in the VA-affiliated patient billing category. The memo referenced Meridian Pharma Solutions by name and described the substitution protocol in clinical language that was, on the surface, impenetrable. But the final line of the second paragraph, tucked into a subclause about cost differential management, described the practice of replacing standard specification medications with reformulated alternatives at equivalent labeling, which was not how you described a legitimate formulary substitution. It was how you described a cover story. Her hands were very steady on the phone. She forwarded the memo to her encrypted account, then deleted the forward from her sent folder and cleared the notification. Then she sat very still for a moment, thinking about the fact that someone inside the hospital, someone with access to internal administrative email, had just sent her the document that connected Alderman's signature to Voss's operation. Her phone buzzed again. Same number. "Who sent you that email?" She typed back. "I don't know. It came from an internal admin address. Generic." A long pause. Then, "Don't ask. Ask. We'll trace it from our end. Do not respond to any further internal emails tonight." She put her phone away. The sky outside the 4th floor windows had started doing the thing it does in the last hour before dawn. Not getting lighter exactly, but changing quality, the darkness losing its depth. She'd always noticed that, in the army and after. The way night didn't end so much as it gave up gradually. Her shift ended at 7 a.m. At 6:48, she was finishing her last chart note when Paula touched her elbow. "Someone at the main entrance," Paula said quietly. "Asking for you by name. Security called up." Megan looked at her. "Asking for me how?" Said they're a patient liaison from a federal medical review office. Has ID. Paula paused. Not Voss's kind of ID. She logged out of the charting system and took the elevator down. The man at the entrance was around 40, compact, in civilian clothes that fit badly in the specific way that means the person wearing them is used to a different uniform. He had a laminated badge on a lanyard that he held out when she approached. Department of Justice, Office of Inspector General, a name she didn't recognize. Calloway, he said. My name is Tabor. I'm with Falk's team. We need to move the timeline up. She looked at him. How far up? Tonight. He glanced once at the security desk. The guard was occupied with a sign-in log, and lowered his voice. We got a data pull on the Meridian distribution manifest. The Kellerton shipment isn't Thursday. It's tonight, 11 p.m. The bottom dropped out of the plan she'd been holding in her head. Voss knows, she said. Probably, which means the moment you clock out, they start moving inventory. We need eyes inside until we can execute entry, and Walsh's— Tabor stopped, seemed to be choosing words. Walsh's condition complicates his mobility. You need me to stay in the building. We need you to stay on shift. We're working the authorization chain right now, but entry can't happen for another 3 hours minimum. Megan looked at the linoleum floor, then at the front entrance doors, then at the badge clipped to her chest that had her name on it, and the word nurse in blue letters and the Stonebridge Memorial logo in the corner. She thought about Alderman telling her to finish her shift and go home, and the way he'd said it like that was the end of the matter. She thought about Paula's nephew and his VA prescription. She thought about 16 patients in the ICU and what was dripping into their veins. I need to make a call, she said. Make it fast, Tabor said. She stepped away from him and dialed the one number she'd been putting off dialing, her shift supervisor, Donna Krause, who ran day shift and who Megan had worked alongside for 3 years and who was, as far as she could tell, entirely unconnected to anything happening in this building. Donna, it's Calloway. I know it's early. She kept her voice steady. I need to request an extended shift. Voluntary. I know you have coverage coming in for days, but I'm flagging a patient situation in ICU 7 that I don't want to hand off cold. Is there any flexibility? Donna, to her credit, didn't ask a lot of questions. She was a practical woman who understood that nurses sometimes developed a clinical attachment to a case and that forcing a handoff at the wrong moment could compromise continuity. You'd be doubling, Donna said. That's a long day. I know. All right, I'll document it as voluntary extended for patient continuity, but I'm pulling you at noon regardless. You hear me? Noon. Noon, Megan said. Thank you. She ended the call and walked back to Tabor. 3 hours, she said. Your team has until I clock out. Tabor nodded once, the economical acknowledgement of someone who was already moving to the next problem. We'll be in position by 9. If anything changes inside, Voss moves up his timeline, they attempt to relocate inventory. Walsh's situation changes. You contact Falk directly, not Reeves. Falk. Understood. And Calloway. He looked at her with the appraising look of someone recalibrating an estimate. Don't take any unnecessary risks between now and entry. You've already done more than we had a right to ask. She didn't tell him that no one had asked her anything. She'd gone into the pharmacy in the basement because a patient asked her to look. And she'd looked. And now here she was at 7 in the morning in the lobby of a hospital that had a fraud operation in its basement, agreeing to stay for another 5 hours because there were 16 people upstairs who were owed the actual medication they were paying for. She went back upstairs. Paula was still at the station when she came through the partition door. You're still here. Extended shift, Megan said. Patient continuity. Paula looked at her for exactly 1 second. Then she turned back to her screen and said nothing, which Megan was beginning to understand was Paula's most eloquent form of communication. At 7:20, a day shift administrator named Burrell came to the nurses' station with a printed form. He was in his 30s, earnest in the way that sometimes meant harmless, and sometimes meant the institution's very willing instrument. He placed the form on the counter in front of Megan without quite meeting her eyes. Mr. Voss asked me to deliver this. It's a formal notice of administrative review, effective this morning. You're restricted to patient care activities only during the review period. No system access beyond charting. No supply documentation. No pharmacy contact. He paused. He asked me to make sure you understood the scope. Megan picked up the form, read it. The language was bureaucratic and careful, and took 3 paragraphs to say that she was not to look at anything she'd looked at last night. "I understand the scope," she said pleasantly. Burrell nodded and left, and she noticed that he'd walked away a little faster than he'd arrived, which meant he wasn't comfortable with what he'd just done, which meant he wasn't fully Voss's creature, just someone doing what he was told, which meant she needed to be careful not to make him collateral damage. At 8:05, her phone buzzed. Falk. Entry authorized. 9:30 a.m. Hold position. At 8:40, the elevator at the end of the corridor opened and Richard Voss stepped out. He was still wearing the same suit. He walked toward the nurse's station without hurrying, without any particular expression, in the way of someone who has decided exactly what they're going to do and is simply moving toward it. He stopped at the counter across from Megan and placed his hands flat on the surface in the same way Alderman had earlier, and she thought distantly that it must be something they taught in hospital administration programs. That particular posture of authority. "I owe you an apology," he said. She kept her face neutral. "For what?" "I was abrupt earlier. You raised a legitimate clinical concern, and I handled it poorly. I'd been dealing with a supply chain issue for 3 days, and I'm afraid I let my frustration show." She watched him. He was very good. The apology was calibrated perfectly, specific enough to seem genuine, vague enough to commit to nothing. "I appreciate that," she said. "I'd like to ask you, as a personal favor, to hold off on the compliance memo until I've had a chance to brief the pharmacy team this morning. We have a meeting at 9. I'd like to present the labeling issue internally before it goes through formal channels." He smiled, and this time the smile was warmer, practiced. "It'll look better for everyone if it comes through the correct process." The 9 a.m. meeting. 45 minutes before Falk's team was scheduled for entry. He wanted her compliance memo, which she hadn't actually written, which he didn't know, delayed past the window when the OIG team would be in the building. "Of course," she said. "I'll wait for your signal." Voss nodded. Held her gaze for 1 beat longer than necessary, the way people do when they're checking for tells, and she held his gaze back with the blank professional attention of someone who had learned, in a very different context, how to look at a threat without letting it look back at anything useful. He turned and walked back toward the elevator. She waited until the doors closed. Then she looked at her watch. 8:42 a.m., 48 minutes. She stood up from the station and walked, at a normal pace, toward ICU 7. She needed to check on Walsh. She needed to update his chart. She needed to look like a nurse doing her job because that was exactly what she was, and she needed to still be doing it when the front doors of Stonebridge Memorial opened in 48 minutes and changed everything. She was halfway down the corridor when she heard it. A commotion from the direction of the stairwell. Not the elevator, the stairs. Low voices, movement, the specific sound of something being moved on wheels. She stopped. 2 men in scrubs she didn't recognize came through the stairwell door pushing a flatbed medical cart loaded with sealed boxes. Behind them, a third figure in a white coat, not Alderman, someone she didn't know, was holding a door open and checking the hallway. The boxes on the cart were the same size and shape as the crates she'd seen in the basement. They were moving the inventory. Not Thursday, not tonight. Right now, at 8:43 in the morning, while Voss was upstairs running an apology designed to keep her in her seat, and Alderman's review was designed to keep her off the systems, and Falk's team was still 47 minutes from authorized entry. She pulled out her phone and typed fast to Falk's number. "They're moving it. Right now. 4th floor corridor, north stairwell. At least 2 carts. They're moving early." She sent it and looked up. The man in the white coat was looking at her from the end of the corridor. He had the still-faced assessment of someone who had just identified a complication, and she was the complication, and she watched him reach into his coat pocket and pull out a phone, and she knew with absolute certainty that in approximately 30 seconds, Richard Voss was going to receive a call telling him that the nurse he'd spent the last 5 hours managing had just seen something she couldn't unsee. Her phone buzzed. "Falk. Moving up entry. Stall them. Do not let those carts reach the loading dock." Megan looked at the cart, at the men in scrubs, at the man in the white coat on the phone. She had no authority. She had no badge rights that applied to this situation. She was a night shift nurse on an administrative review hold who had been told explicitly not to access supply documentation. She walked toward them anyway. "Excuse me," she said, keeping her voice level and her pace unhurried. "I need to see the transfer authorization on those boxes." The man in the white coat lowered his phone. The two men in scrubs stopped the cart. And in the specific silence that followed, Megan Calloway, who was not an investigator, not an agent, not anyone with the authority to stop a single thing, stood in the corridor of the fourth floor of Stonebridge Memorial Hospital and waited to see which way it broke. The man in the white coat had a name badge that read Dr. Soren Pry. But the way he held himself when she walked toward him, weight balanced, shoulders squared, jaw set, was not how doctors stood when a nurse asked them for paperwork. It was how people stood when they'd been told to expect a problem, and the problem had just materialized. Transfer authorization, Megan said again, stopping 2 feet from the cart. She kept her voice the same way she'd kept it through every conversation tonight. Flat, professional, the specific register of someone who believes they have every right to be doing what they're doing. These boxes are moving through a patient care corridor. I need to see the documentation. Price looked at her the way people look at something they're deciding whether to step around or step on. These are being relocated per administrative directive. It doesn't require nursing authorization. Anything moving through ICU floor space during active patient hours requires a transport manifest signed by the charge nurse or the floor supervisor. That's Stonebridge Policy, Chapter 4, Section 9. She had no idea if that was the correct chapter and section. She was reasonably confident he didn't either. I'm the senior nurse on this floor right now, so I need the manifest. The two men in scrubs had stopped pushing the cart. They were looking at Price, waiting. They weren't hospital workers. She was almost certain of that now. Their scrubs were the right color, but the wrong fit, the kind of wrong that comes from dressing in a hurry from someone else's supply. One of them had a lanyard clipped to his waistband with no badge on it, just the clip, which was exactly backwards from every actual hospital employee she'd ever seen. Price put his phone back in his coat pocket. I don't have a manifest on me. The documentation is being processed downstairs. Then the cart stays here until it arrives. She positioned herself beside the cart, not blocking it, not touching it, just there, in the specific way that made moving it require going through her first. I'm happy to wait. The silence lasted about 4 seconds, which was long enough to confirm that Price was not going to produce a manifest, had not been prepared for anyone to ask for one, and was currently doing the math on his options. She could see it happening, the slight tightening around his eyes, the shift of his weight onto his back foot. His phone buzzed. He glanced at the screen. Whatever he read there changed something in his expression, not panic, but a controlled urgency that hadn't been there before. Move the cart to the service elevator, he said to the two men in scrubs. Now. That's the wrong direction for the loading dock, Megan said. Nurse Calloway. He said her name like it was a warning. Step back. Show me the manifest and I will. One of the men in scrubs reached out and physically moved her arm. Not rough, but deliberate, the kind of contact that is technically not assault and is absolutely a message, and pushed the cart forward past her. She let them move the cart because stopping it physically was not something she could do, and she was not going to pretend otherwise. What she could do, and did, was pull out her phone and start recording. Not covertly. Openly. She held it up and filmed the cart, the boxes, the men in scrubs, Price's face, the corridor, the stairwell door they'd come from. Price's hand came up, not toward her but toward the phone. You cannot record on hospital premises without patient safety documentation, floor supervisor authority, same policy, Chapter 7. She stepped back and kept filming. I'd rather this not escalate, Dr. Price. If the manifest is coming, we can resolve this in 2 minutes. His phone buzzed again. This time, he answered it. Turned away from her, dropped his voice. She caught fragments. 4th floor, she's... And then I understand, and then something she didn't catch. And then he turned back around with the look of a man who had just received instructions that he was not going to enjoy carrying out. You're going to want to put that phone away, he said. Why? Because Richard Voss is on his way up, and when he arrives, your continued employment at this hospital is going to depend on how cooperative you've been in the past 5 minutes. She kept filming. I'm being completely cooperative. I'm asking for documentation of a supply transfer on a patient floor. That's my job. Price stared at her. Behind him, the two men in scrubs had stopped the cart again, caught between his contradictory instructions, waiting. One of them was doing that thing people do when they're nervous, shifting his weight from foot to foot, just slightly, not enough to be obvious, but enough for someone trained to watch people to notice. Her phone buzzed against her palm. She glanced at the screen without lowering it. Falk. Entry in 22 minutes. We have units at both building exits. Do not let them reach the loading dock or the service vehicle bay. 22 minutes. She looked at the cart, at the stairwell behind it, at the elevator at the far end of the corridor. The service elevator was in the opposite direction from the loading dock. Price had sent the cart that way, which meant he wasn't heading for the dock yet. He was stalling too, waiting for Voss, trying to manage the situation until someone with more authority arrived to deal with her. They were both running out the clock, just in different directions. The elevator at the end of the corridor opened. Voss stepped out. He'd changed jackets. Subtle difference, but she noticed, which meant he'd been somewhere that had required it. Behind him came Alderman, which was unexpected, and behind Alderman came a man she hadn't seen before, taller than both of them, in a suit that was better than Voss's, with the bearing of someone accustomed to being the most important person in any room he entered. She stopped recording and pocketed her phone. She'd gotten enough. Voss walked toward her at the same measured pace as before, and his face had the controlled pleasantness of a man who has decided that this situation requires a particular kind of handling. Megan, he said, dropping the formal last name, which was its own kind of move. I think we got off on the wrong foot this morning. Let me introduce someone. He gestured to the tall man. This is Gareth Sloan. He's the chief operating officer of our parent health system. He came in early this morning because of the supply chain irregularity you flagged last night. Sloan extended his hand. Miss Calloway, Richard tells me you've been thorough. She shook it. I've been doing my job. Absolutely. Sloan had one of those voices that filled a space without being loud. The executive frequency, smooth and confident and designed to communicate that whatever was happening had been anticipated and managed. We want to assure you that the concern you raised is being handled at the highest level. The vendor in question, Meridian, has been flagged for a compliance review, and the shipment in question is being quarantined pending that review. He gestured toward the cart. That's exactly what this transfer is. Quarantine relocation to secure storage. It was very good. The whole thing was very good. If she hadn't been in the basement last night with her cheek against a cold floor, it would have been completely convincing. Which secure storage? She said. Sloan paused. Tiny pause. Almost invisible. Excuse me? The quarantine location. Which storage unit? And who signed the quarantine order? Sloan looked at Voss. The look lasted less than a second and said more than either of them intended. The documentation is in process, Voss said. That's the same answer Dr. Price gave me. She stood her ground. Not aggressively. She wasn't raising her voice, wasn't gesturing, was just standing there with her arms at her sides and her eyes on Voss's face. I understand you're handling this at a high level. I would like to confirm that the handling is going through proper channels, since I have 16 active patients on this floor who have received medication from this shipment. If there's a compliance issue with the vendor, I need to know the clinical implications for my patients before that inventory moves anywhere. Alderman stepped forward. Nurse Calloway. Dr. Alderman, I have 6 patients whose next antibiotic dosing cycle is in approximately 40 minutes. If the active lot is being quarantined, I need to know whether I'm pulling those lines and switching to alternative sourcing, or whether the quarantine is precautionary and current dosing continues. That is a clinical question that requires a clinical answer before anything on that cart goes anywhere. She looked at Sloan. Sir? Sloan was quiet for a moment. He was recalibrating. She could see it. She'd taken the conversation out of the administrative register, where he had all the authority, and moved it into the clinical register, where he had none and would look incompetent disagreeing with her. What's the dosing window? He asked, and the fact that he was asking rather than deflecting meant she'd landed the point. 6 patients, 40 minutes to next cycle. If I'm switching protocols, I need pharmacy authorization, alternative lot sourcing, and updated orders from the attending for each patient. That's a minimum of 30 minutes of clinical work. She paused. I can start right now if someone can confirm the quarantine. Voss's jaw tightened by a fraction. The cart couldn't move while she was citing patient care requirements. Pulling it would be explicitly prioritizing inventory transfer over active patient clinical need, and even Sloan wasn't going to let that be documented. Give her the clinical confirmation, Sloan said to Alderman. Low, controlled, irritated. Alderman looked like he'd swallowed something unpleasant. The quarantine is precautionary. Current patient dosing is not affected. I'll need that in writing for the chart, Megan said. Standard CYA. I'm sure you understand. The silence that followed had a texture to it. The specific silence of people who are trapped by their own cover story and know it. Her phone buzzed. She didn't reach for it. Of course, Alderman said. He pulled out his own phone and typed something rapidly. I'm sending it to the chart system now. Thank you. She turned to the men with the cart. I'll need to document what's on that cart for the clinical record. Just a box count and lot number confirmation. It'll take 3 minutes. Neither man moved. They were both looking at Price, who was looking at Voss, who was looking at Megan, with an expression that had finally dropped the pleasantness entirely. She was looking back at him with the same flat attention she'd given him all night. And in the 11 seconds that passed between them, they both arrived at the same understanding. The pretense was over, and they both knew it, and the only remaining question was what either of them was going to do about it. Get the cart to the elevator, Voss said quietly to Price. Not to her. Not explaining it to her or arguing it with her, just giving an order to someone else and waiting to see what she did. Mr. Voss, she said, if you move that cart without clinical documentation, I'm going to have to call the State Health Department's supply chain hotline and file an emergency flag. I can do that from this hallway in about 90 seconds. She held up her phone. It triggers an automatic hold on any medical inventory transfer in the flagged facility for 6 hours while a state inspector is dispatched. I'll do it. You don't have grounds. I have 16 patients who received medication from an unconfirmed lot in an unverified shipment from a vendor with no established relationship to this hospital. That's the grounds. And I will absolutely stand here and file it. She would. That was the thing. She had looked up that hotline number 2 years ago during a different supply issue, had memorized it the way she memorized things she might need, and she would absolutely dial it right now and state exactly what she'd seen, and it would trigger exactly the hold she'd described, because she was not bluffing, and she was the only person in this corridor who wasn't. Voss looked at her. She looked at him. And then Voss looked at the wall behind her, at something over her shoulder, and his expression changed in a way she had not seen it change all night. Not the controlled flatness, not the managed pleasantness. Something that was closer to actual alarm. She turned. At the end of the corridor, coming through the partition door, were 4 people in civilian clothes with federal identification badges on lanyards, moving with the particular organized speed of people who have done this before and are doing it correctly. Leading them was a woman around 50, compact, with close-cropped gray hair, and the face of someone who has learned to move through institutional resistance the way water moves through rock. Not forceful, just persistent and inevitable. Falk. Behind her, 2 of the 4 carried document cases. The other 2 wore the specific kind of lanyard that meant law enforcement, even when everything else about them was carefully civilian. The door at the stairwell end of the corridor opened simultaneously. 2 more, 6 minutes ahead of schedule. Falk walked directly to Voss. Richard Voss, she said. I'm Deputy Inspector Falk, Office of Inspector General, Federal Contract Fraud Division. I have a federal warrant authorizing the search and seizure of pharmaceutical inventory, documentation, and digital records at this facility. She held out the warrant folder. Your cooperation is appreciated but not required. Voss looked at the warrant. His face had gone very still. Not the performed stillness he'd worn all night, but the involuntary stillness of someone whose entire architecture of management has just collapsed in one sentence. Sloan stepped forward. I'll need to contact our legal... You're welcome to do that, Falk said, without looking at him. From outside the secure perimeter. Mr. Voss, I need you to step back from the cart. The inventory will be inventoried and processed. Don't touch the boxes. One of the agents, not law enforcement, a forensic accountant, she'd learn later, moved immediately to the cart and began photographing the boxes with a professional camera, methodical and rapid. Price had taken 2 steps back toward the stairwell door. Dr. Price, said one of the men at the stairwell end, stay where you are, please. The 2 men in fake scrubs had gone very still in the specific way of people who are calculating whether any exit remains available and have just finished calculating that none does. Megan stood in the middle of it all and felt the adrenaline that had been running through her for the past 6 hours begin, slowly, to metabolize. Her hands were shaking. She hadn't noticed that until now. Falk turned to her. Calloway, are you all right? I'm fine, she said, which was approximately true. The patient in ICU 7. Walsh. What's his current status? Fever down half a degree as of 40 minutes ago. New IV line running clean. He's stable. Falk nodded. We're sending a medical team to evaluate him independently. Standard protocol. She looked at Megan for a moment with the appraising expression that Megan had begun to recognize as Falk's default. You stalled them for 17 minutes with a manifest request and a state hotline threat. The manifest request was legitimate procedure, Megan said. The hotline call would have been too. I know. Something shifted in Falk's expression. Not warmth exactly, but acknowledgement. Go check your patients, Calloway. We've got it from here. Megan walked back toward the nurses' station. Paula was standing at the partition door, watching the corridor with the expression of someone who has been working in a hospital long enough that very little surprises them, but this particular thing is making a run at it. Federal agents, Paula said, not a question. Yeah. On my floor. Yeah. Paula looked at the organized movement in the corridor. Agents, document cases, Voss being separated from the cart. Sloan on his phone with the controlled fury of someone whose call to legal counsel is not going well. I'm going to need coffee, she said finally. Me too, Megan said. She didn't get coffee. She went to ICU 7. Walsh was sitting fully upright when she came in. His color was better. Not good, but better. The flush of fever receding enough to show the actual structure of his face underneath. He looked at her when she walked in, and something in his posture changed. The particular drop of tension in the shoulders that happens when someone who's been waiting for confirmation finally gets it. Falk's here, she said. I know. Someone came in and told me 20 minutes ago. He watched her check his monitor. How are you doing? You keep asking me that. You keep looking like someone who's holding a lot together with not much left to hold it with. He said it without particular gentleness, just as an observation. I've seen that look before. It's not a bad look. It just means you're running on the last third of your reserves. She adjusted his drip rate and didn't answer, because the answer was that he was right, and she didn't have the energy to disagree with accurate assessments. Voss tried to walk it back, she said instead. Brought in the health system's COO. Tried to frame the inventory move as a legitimate quarantine. How'd you handle it? Clinical grounds, patient dosing window. Threatened a state supply chain flag. Walsh was quiet for a moment. Did you actually know about the supply chain hotline, or did you make that up? I knew about it. He made a sound that was almost a laugh. Of course you did. He leaned back against the pillow. There's going to be a deposition process. Falk's team will want a full statement from you. Everything you accessed, everything you heard, everything you documented. It's going to be thorough. I know. Your employment here, I know that too. He looked at her. She was standing at the foot of his bed with her arms at her sides, and she was tired in a way that had gone past the physical into something more essential, and she wasn't trying to hide it from him because there didn't seem to be any point. He'd spent the whole night watching her with the attention of someone who was used to reading people and had gotten good at it. For whatever it's worth, he said, I've worked alongside a lot of people in a lot of different situations. What you did tonight, the pharmacy, the basement, the corridor just now. Most trained people would have pulled back after the first encounter with Voss. You didn't. It wasn't courage, she said. It was stubbornness. Usually is, he said. She checked his temperature, 101.4, down from 104 at admission. Still elevated, still requiring monitoring, but the trajectory was right. She noted it in the chart and updated the attending order flag. The attending order flag would now go to Falk's team's medical liaison, since Alderman was currently standing in a corridor and answering questions from federal agents, which made the flag somewhat hypothetical. She noted that too. She was in the medication room, pulling alternative lot sourcing for her 6 patients whose dosing cycle was now overdue by 20 minutes, when Burrell found her again. He looked worse than he had this morning, the earnest quality gone, replaced by the specific paleness of someone who has spent the last hour realizing that the thing they'd been participating in was significantly larger than they'd understood. They're asking for me, he said. The federal agents. They want everyone who had administrative contact with Voss or Sloan in the past 6 months. Then go talk to them, Megan said. She was checking lot numbers with the same methodical attention she'd used all night. I want you to know I didn't know what it was. He stopped. Seemed to understand how inadequate that was. I knew something wasn't right. A few months ago, the Meridian vendor approval. The signature on it didn't match our normal authorization chain, and I asked Voss about it, and he said it was a system update. Burrell, she said, go talk to the agents. Tell them exactly what you told me, all of it. He nodded and left, and she thought about the fact that the operation had been visible, in small ways, to several people, and that most of them had done what Burrell had done, asked a single question, received a plausible answer, and moved on. Because the answer was plausible, and the alternative was difficult, and there was always another shift, another form, another thing that needed doing and seemed more immediately pressing than the thread you'd started pulling. She thought about Walsh saying you were the only one who looked at the patient. She finished pulling the alternative lot medication, double-checked every bag, and went to do her rounds. By 10:15, the fourth floor of Stonebridge Memorial looked nothing like a hospital floor and everything like a crime scene, in the specific, bloodless way of financial crimes, which left no visible damage but disrupted every surface. Agents moved through the corridors with tablets and document cases. The pharmacy was sealed with printed notices. The stairwell to the basement was blocked by 2 agents who politely redirected anyone who tried to use it. She passed Voss once in the corridor. I was sitting in a chair outside what had been the supply coordination room, now apparently designated as a field interview space, with an agent on either side of him and the expression of a man who has been in controlled environments his entire career and has just encountered one he didn't build. He didn't look at her as she passed. Alderman was in the family waiting area at the end of the floor, on the phone with what she assumed was his attorney, his voice pitched low and urgent. When he saw her, he stopped talking. She kept walking. At 10:40, Falk found her in the break room. The break room was the one space on the floor that felt unchanged. Same microwave, same folding chairs, same bulletin board with the rotation schedule, and the laminated hand-washing reminder, and the birthday card someone had taped up for a nurse who'd transferred out 3 weeks ago and never taken it down. Falk sat across from her with 2 cups of coffee, the terrible break room kind, and put one in front of Megan without asking. The basement staging area is fully documented, Falk said. The secondary room had inventory representing approximately $4.2 million in VA and TRICARE fraudulent billings over 11 months. DeVere, Marcus DeVere, was in the building this morning. He's in custody. And Voss? Being interviewed. His attorney arrived 20 minutes ago. Falk wrapped both hands around her coffee cup. The memo you forwarded, the one from the internal admin address. We traced the sender. Megan looked at her. It came from Burrell's workstation login, but the access time was before his shift. Someone used his credentials remotely. Falk paused. We think there's a third party inside the operation who is not aligned with Voss. Someone who wanted the memo to reach you specifically. Someone inside the hospital who's been feeding information. That's our current read. We don't know who yet. Megan thought about that. She thought about the generic admin address and the timing and the precision of the document. Not a random file. Exactly the memo that connected Alderman's signature to the Meridian authorization. The specific document that a person inside the operation would know mattered. Price, she said. Falk looked at her with slightly increased attention. Why Price? He came up through the stairwell, not the elevator. He was the one directing the cart, but he wasn't loading it. He was supervising it. And when Voss gave the order to move the cart past me, Price looked at Voss the way someone looks at a superior when they're not sure the decision is right, but they're going to follow it anyway. She paused. It might be nothing, but he was already in the building when Voss arrived, and he was on a phone call when he first saw me in the corridor, and he ended it the moment Voss showed up, like he was reporting to someone, and that someone wasn't Voss. Falk was quiet for a moment. He's been interviewed. He denied knowledge of the operation's scope. That's not a denial, Megan said. No, Falk agreed. It's not. She picked up her coffee. Your statement. I need it formally. It can wait until you've slept, but we'd like it within 24 hours. I can do it this afternoon. You don't have to. I'd rather do it while it's all still clear. She looked at the bulletin board, at the birthday card. What happens to the patients, the 16? Medical liaisons are doing clinical reviews of all affected cases. Alternative sourcing is being arranged. Every patient's chart is going to the state medical board for independent review. Falk's expression was careful. Most of them are going to be all right. The substituted compound wasn't inert. It had some antibiotic activity, which is probably why the substitution wasn't caught earlier, but it was significantly below efficacy. Patients with acute infections were undertreated. Walsh. Walsh's outcome is better because you caught it last night. If he'd gone another 12 hours on the compromised dosing— Falk didn't finish the sentence. Megan nodded. She'd already done that math. Her phone buzzed. Paula. Room 4 calling for you. Says he doesn't want the day nurse. Says only the one from last night. She finished her coffee in 2 swallows, stood up, and straightened her scrubs. I need to check on a patient, she told Falk. Of course. Falk stood too. Calloway. I need to tell you something, and I need you to hear it correctly. Megan waited. The administrative review hold that Voss filed this morning. It's been voided as of 9 a.m. by our order. Your employment record is clean. Falk paused. What you did last night was right. I want you to hear that from someone with authority to say it. Megan looked at her. She felt something move through her that she couldn't easily name. Not relief exactly, because relief assumed she'd been afraid, and she hadn't exactly been afraid. It was more like the thing that happens when you've been carrying something for a long time, and someone simply takes it out of your hands without making a production of it. Thank you, she said. She went to check on her patient. The day had gone strange and bright outside the 4th floor windows. The particular late morning light that seemed wrong after a night without sleep, too sharp, too certain of itself. She did her round with the methodical attention that had carried her through the night, the same attention she'd been paying to these patients through 11 months and 3 days on this floor. Checking lines, checking monitors, reading faces, asking the questions that took longer than reading a chart but told you more. At 11:30, she was at the nurse's station updating the last chart when her phone rang. Not a number she recognized. She answered. Calloway. This is Colonel Adara Wynn. The voice was clipped, precise, the flat authority of someone who was used to being the highest-ranking person in any room. I'm the commanding officer of the Federal Medical Logistics Oversight Unit that Walsh operates under. I'm calling to inform you that his federal assistance record has been reviewed, and the protocol that omitted full disclosure to civilian contacts is being flagged for revision. A pause. That's the formal part. The informal part is that what you did last night put our operation in a position to close a case that's been open for 14 months. I wanted to say that to you directly. Megan didn't know what to say to that, which was unusual. Is Walsh going to be all right? She asked. His medical team says yes, the infection is responding. Good. Another pause. You were an Army medic. 14 months forward deployed, Kellerton Regiment, 2016 to 2017. Then you know how this works, Wynn said. The people who matter are the ones who do the job, not the ones who get the recognition for it. Yes, ma'am. You're getting the recognition anyway, Wynn said. Prepare for that. She hung up. Megan set the phone down on the counter and looked at the nurse's station. The familiar clutter of it, the charts, the call light board, the coffee cup. Paula had left beside the monitor, the birthday card still up on the board down the hall. She'd been sitting in this exact spot, or one like it, for 3 years. The station looked exactly the same as it had yesterday. Everything behind it felt entirely different. At 11:55, 5 minutes before her noon clock out, Paula appeared at the partition door with the expression of someone carrying news they haven't decided how to frame yet. Calloway? Yeah. They found something in the basement. Paula stopped. In the secondary room, behind the shelving unit on the far wall. Megan felt the stillness come back. The deliberate kind. What kind of something? Another door, Paula said, leads to a sub-basement level. Nobody knew it existed. The agents have been down there for 40 minutes. She looked at Megan with the flat directness that was her natural mode. They're saying it's bigger than they thought. The birthday card on the bulletin board shifted slightly in the air from the HVAC vent above it. Megan's phone buzzed. Falk. Come back to the break room. Now. Bring nothing. Tell no one where you're going. She looked at Paula. Don't clock me out, she said. She walked toward the break room. The break room felt smaller than it had 20 minutes ago. Falk was standing when Megan came in, which meant she'd been pacing, which was the first time Megan had seen her do anything that wasn't completely controlled. There were 2 other people in the room. A man Megan didn't recognize, lean and dark-haired, with the kind of stillness that read as trained rather than natural, and a woman with a forensic accounting badge on her lanyard who is looking at a tablet with the focused expression of someone who has just found something and hasn't finished understanding what it means. Falk pointed at a chair. "Sit down." Megan sat. "The sub-basement," Falk said. "What do you know about Stonebridge's building history?" "Nothing specific. It's an old building. Parts of it predate the current hospital by 40 years. There was an industrial facility on this site before the medical center was built. I've heard maintenance staff mention it. The sub-basement predates the hospital by 37 years. It was decommissioned when the medical center was built, sealed off, and is not on any current facility schematic." Falk turned the tablet in the forensic accountant's hands so Megan could see the screen. "This is what our team found down there." The photograph on the tablet was a wide-angle shot of a large underground space, lit by temporary work lights that agents had presumably brought in themselves. It was not a pharmaceutical staging area. It was something that looked at first glance like a server room. Rows of enclosed rack units, cable management, a dedicated cooling system. But the rack units weren't standard IT infrastructure. They were custom-built, modified, the kind of thing you'd only recognize as unusual if you knew what standard looked like. "Data servers," Megan said. "Custom-built cold storage arrays," the lean man said. He had an accent she couldn't quite place. Something from the upper Midwest worn flat by years of deliberate neutrality. "For pharmaceutical batch records, manufacturing logs, distribution chains. They've been archiving the full operation down here for at least 3 years. 3 years. The number sat on the table between them with the weight of everything it implied. Meridian Pharma Solutions wasn't just a shell company for the substitution scheme, Falk said. It's a distribution network with 17 hospital contracts across 6 states. Stonebridge was the regional hub, but it wasn't the origin point. The origin is a manufacturing facility operating under a different corporate name that traces back to a holding company that traces back. She stopped, seemed to decide how much to give. It goes further than we thought, significantly further. Megan looked at the photograph on the tablet, at the racks, at the cables running neat and deliberate along the ceiling of a space that no one was supposed to know existed, under a hospital that was supposed to be healing people. "How many patients total?" she asked. "Across all 17 contracts." The forensic accountant looked up from her tablet. "We don't have a full number yet. Conservatively, several thousand over 3 years. Patients on VA benefits, TRICARE, active duty dependent coverage. The substituted compounds were calibrated to show partial efficacy, enough to avoid immediate red flags on outcome data, but insufficient for patients with acute conditions or immunocompromised status." She paused. Patients who needed full efficacy and didn't get it experienced extended illness, secondary infections, delayed recovery. Some were readmitted. Some of those readmissions are in the data. She didn't say anything beyond that. She didn't need to. Megan thought about Walsh's shoulder, the shrapnel that never came out, the recurring infection, the 3 hospitals in 8 months. She thought about what Falk had said. If he'd gone another 12 hours on the compromised dosing, she thought about all the other Walshes. The ones who hadn't specifically sought out a nurse with a reason to look. The ones who'd just gotten sicker and gone home and gotten sicker again and didn't know why. "You said Stonebridge was the regional hub," she said. "Not the origin. Where's the origin?" Falk and the lean man exchanged a look. It was the look of people deciding how much a civilian needs to know, which was a look Megan had been on the receiving end of enough times to find it mildly infuriating. "Kellerton," she said. Falk's expression shifted by a fraction. "Why Kellerton?" "Voss said the Kellerton shipment goes out Thursday. Walsh's VA doctor was in Kellerton. The Kellerton Regiment was my unit's partnered command in 2016. It's a military-adjacent city. Big VA presence, large active duty population, significant federal medical contract volume." She looked at Falk steadily. "Is the manufacturing facility in Kellerton?" The lean man said, "We can't confirm operational details that are part of an active—" "Yes," Falk said, overriding him. "Outside the city limits. A licensed pharmaceutical compounding facility operating under a different corporate identity. The license is legitimate. The compounding certification is legitimate. The problem is what they're compounding and what they're labeling it as." She picked up her coffee cup, found it empty, set it back down. "The facility has federal contracts. That's the part that takes this from fraud to something considerably more serious." Federal contracts. which meant federal money, which meant the substitution scheme had been funded, at least partially, by the government whose soldiers it was undertreating. Who owns the holding company? Megan asked. We have 4 names on the corporate registry, Falk said. One of them, you know. She waited. Gareth Sloan, Falk said, the health systems COO who was in the corridor this morning. He's not just the system's chief operating officer. He's a partial owner of the manufacturing entity through a series of holding structures that our financial team spent the last 2 hours tracing. She looked at Megan with the careful directness she'd used all morning. He came to the hospital this morning not to manage a supply chain issue. He came because Voss called him when you started asking questions, and he needed to see how much you knew and whether you could be contained. The corridor this morning, Sloan extending his hand. Ms. Calloway. Richard tells me you've been thorough. The calibrated warmth of it, the practiced authority, the very good performance of a man who had built an entire parallel operation inside a legitimate healthcare system and had been managing problems like her for 3 years. Where is he now? She asked. Being interviewed. His attorney arrived 40 minutes ago and has been significantly more aggressive than Voss's. Falk's mouth tightened slightly. Sloan's attorney is arguing that the corporate structures create sufficient legal separation between Sloan personally and the operational activity at the facility. It's not a frivolous argument. It's going to make the case harder. But not impossible. No, not impossible, especially with the server room. The archived batch records are direct operational documentation that bypasses the corporate layering, she paused, and especially with the memo. The memo I forwarded. The one that was sent from Burrell's workstation using credentials that weren't Burrell's. Falk looked at her. We identified the source. It was Price. Megan remembered the corridor. Price on the phone when she'd first appeared. Price ending the call the moment Voss arrived. Price giving contradictory cart directions. First to the service elevator, away from the loading dock, buying time. He was feeding information, she said, for 6 months. He approached the OIG field office in Kellerton after he was recruited into the operation and realized its scope. He accepted a position as a distribution coordinator for the network, which is what Marcus DeVere recruited him for, which is why he was here this morning, and simultaneously began providing information to our office. Falk paused. He's the reason we had a team staged in Harlow. He flagged the Thursday timeline 2 weeks ago. When the timeline moved up, he didn't have a secure channel to warn us, so he used Burrell's credentials to get the memo to you. He used me as a relay. He used you as the most credible inside source available in real time, yes. Falk looked at her without apology. You weren't the only person working an angle last night. Megan absorbed that. She thought about Price's face in the corridor when she'd started filming. Not the calculation she'd read as threat assessment, but something more complicated. A man running 2 roles simultaneously, managing his position in an operation he was working to bring down, and watching a night shift nurse do in 6 hours what his 6 months of inside work hadn't quite accomplished. What happens to him? She asked. Cooperation agreement. He'll testify. His future depends significantly on how useful that testimony is. Falk set both palms flat on the table. Calloway, I need to tell you something that's going to be uncomfortable. She waited. The deposition process for a case this size is going to be extensive. Your name will appear in federal court filings as a material witness. That becomes a matter of public record. Falk held her gaze. The people you've helped put in that position have attorneys and resources and a significant interest in discrediting every witness. You should expect that process to be unpleasant. I know how it works, Megan said. I testified in a military medical review in 2017. I know what it costs. Falk nodded slowly. Then you also know the other side of it. Yeah, Megan said. I do. She stood up and smoothed the front of her scrubs, which were the same ones she'd put on at the start of yesterday's shift, and which had been through a basement and a confrontation and 16 hours of everything else, and showed it. She thought she probably looked exactly like what she was, a person who had been awake for a very long time and had spent that time doing something difficult. I'll have my formal statement ready by 3 p.m., she said. I need to clock out, sleep for 4 hours, and eat something. Take more than 4 hours, Falk said. I'll take what I have. She moved toward the door. Calloway. She looked back. Falk's expression was the least guarded it had been all morning. The deputy inspector faced down slightly, something more direct underneath. What made you go back to the basement after I specifically told you not to? Megan thought about it. About the storage wing and the cold floor and the gap under the door, and Voss's voice saying one way or the other. About the weight of the IV bag in her hands. I didn't go back to the basement, she said. I went to the stairwell and listened when it sounded like something was happening in the corridor. That's inside the building. You said not to go to the basement. She held Falk's gaze. I followed your instructions. Falk looked at her for a long moment. Of course you did, she said. Megan went to clock out. The locker room was empty. She changed out of her scrubs into the jeans and sweatshirt she kept in her locker. The after-shift clothes of someone who had learned long ago that wearing hospital clothes home was a form of never fully leaving, and sat on the bench for a moment with her shoes in her hands. Her body had started sending signals it had been politely suppressing for the past several hours. Her feet hurt. Her shoulders were knotted in a specific way that meant she'd been carrying tension through her upper back for longer than she'd noticed. Her eyes felt gritty and over-dried. She put her shoes on and left. Paula was still at the station, still there, still working, the kind of durability that came from decades of showing up. She looked up when Megan passed. Going home? Paula said. 4 hours, then back for my statement. You don't need to come back tonight. I know. But you're going to. Yeah. She stopped, looked at Paula directly. You held the visiting log. Still have it. Paula's expression was the flat, careful one. Should I give it to the agents? Yes, give it to Falk directly. Tell her I said it documents every visitor to ICU 7 from the past 12 hours through a non-administrative channel. She'll know what it means. Paula nodded once, the economical acknowledgement. Get some sleep, Calloway. She walked out. The parking lot was the ordinary daylight version of itself. Cars, a delivery van, 2 pigeons on the concrete median near the entrance, a paper coffee cup tumbling in the wind along the curb. After 16 hours inside a building where the walls had been steadily closing in, the specific normality of the outside world was almost disorienting. She stood next to her car for a moment and let the October air move through her. Her phone rang. Unknown number, Harlow area code. She answered. Calloway? This is going to sound strange, said a man's voice, older, careful. My name is Terrence Webb. You don't know me. But 4 years ago, in the ER at Harlow General, a nurse pulled a syringe out of a doctor's hand before it went into my IV line. A pause. That was you. She was quiet for a moment. Mr. Webb, I know it's been a long time. I know you probably don't. I remember, she said. I remember exactly. Yeah. He stopped. She could hear him working through something on the other end. I've been following some of the news coming out of Stonebridge today. The federal investigation. They mentioned a nurse. They didn't say your name, but I know some people, and I made some calls. Another pause. I don't know what's happening over there exactly, but I heard enough to know it's the same kind of thing. Someone not looking the other way. Mr. Webb, I just wanted to say thank you, he said. Again, for the first time in whatever this is, I know that's not very... He stopped. Seemed to give up on finding the right framing. Thank you. She leaned against her car and looked at the 2 pigeons on the median. How's your health? She asked. Good, he said, surprised. Really good, actually. Good. I'm glad, she said. And she was. And it was that simple. And she let it be. She drove home. She lived in a second-floor apartment 12 minutes from the hospital, which she'd chosen specifically for its proximity in the calculus of a person who worked night shifts and didn't want to spend time commuting that she could spend sleeping. The apartment was small and not particularly decorated. A bookshelf that was mostly medical references and paperback thrillers, a kitchen table she used as a desk, a second-hand couch she'd had since her first post-army apartment. She'd never done much to the walls. She made toast, ate it standing over the kitchen sink, and was asleep by 1:15 p.m. She woke at 4:45, which was longer than 4 hours, and felt the specific residue of deep emergency sleep. Not rested exactly, but stabilized. She made coffee, read through the news on her phone. The Stonebridge story had broken around noon. A regional outlet picked it up first, then 3 national feeds. The coverage was careful and factual, and mentioned a federal search warrant and the OIG and pharmaceutical fraud, and at the bottom of the 3rd article there was a single sentence. Hospital staff are being credited with initiating the investigation by federal sources. She drank her coffee and got dressed and went back. At 5:30 p.m., she sat across from a federal recorder in what had been the fourth-floor family waiting area and gave her formal statement. It took 2 hours and 20 minutes, and the agent taking it, a patient, thorough man named Ito, walked her through every decision point of the night with the methodical attention of someone building a structure that has to hold weight. She answered everything directly, corrected 2 details where her initial account had been imprecise, and was asked 3 times to confirm the sequence in the basement before Voss and Marcus arrived. She confirmed it 3 times. At 8:10, Ito clicked off the recorder. "That's thorough," he said. "It's accurate," she said. "I don't know if it's complete." "It's the most complete inside account we have. Walsh's is more detailed on the operational side, but yours covers the clinical evidence chain." He capped his pen. "You understand you'll be contacted for potential testimony?" "I do." She went back to the floor. Walsh was sitting upright, fever at 100.1, which was nearly normal, his color completely different from the gray-white it had been 20 hours ago. The day shift nurse, a steady, experienced woman named Lori, who Megan respected, had managed his care through the afternoon with the competence she'd expected. His shoulder dressing had been changed. His antibiotic line was running clean, correct lot, verified source. He looked up when she came in. "You came back." "I had a statement to give." "That's not why you came back to the floor." She sat in the chair she'd pulled up last night. It was still in the same spot. Nobody had moved it. "How are you feeling?" "Better than I have any right to feel." He shifted his weight and winced, residual, habitual, the wince of someone who had been hurting for so long it had become background noise. "I heard the statement went well." Ito said it was thorough. High praise from Ito. Walsh turned the inside of his wrist up, an old habit, she noticed, of someone checking their own pulse without a monitor. 14 months forward deployed had left her with the same habit. "They found the sub-basement." "I know." Sloane's attorneys have been making noise all day, trying to create separation between him and the operational structure. He was quiet for a moment. "It's not going to work. The server room documents his access directly. There are logs going back 30 months. Falk told me it was going to be complicated." "It is complicated. It's also very well documented now." He looked at her. "What Price did, going into the operation to help shut it down, that takes a specific kind of tolerance for impossible positions. I've known people who could do it, and people who thought they could and found out they couldn't." He paused. "He did it well. He used me without telling me." "Yes." "So did you." "Yes." He held her gaze. "I know." She sat with that for a moment. She wasn't angry about it, which she'd expected to be. She was something more tired and more pragmatic than anger. The recognition that the situation had been what it was, and that everyone in it had done what they'd done with the information they had, and that the outcome was the one she'd have chosen if she'd been choosing. "The memo he sent me," she said, "the one that connected Alderman's signature to the Meridian authorization. That was the piece that would have taken me longest to find on my own, if I'd even found it." He knew that. He picked the right relay. He did. Walsh's expression held something that wasn't quite a smile. "To be fair, you were the only option." She almost laughed. She didn't, but it was close. Her phone buzzed. "Falk. Press briefing scheduled 9 a.m. tomorrow. Your name will be referenced. Not identified by personal detail, but referenced as clinical staff. Wanted you to have advance notice." She read it, texted back. "Understood." Then a second message from Falk. "Sloane is requesting a meeting with you. His attorney made the request this evening. We're not facilitating it. This is your call. He asked for it personally." Megan read that one twice. She thought about Sloane in the corridor this morning, the practiced warmth, the calibrated authority, the hand extended in false collegial good faith. She thought about what it meant that he was asking to meet with a night shift nurse instead of focusing his considerable legal resources on the 4 people between him and prosecution who had more institutional authority than she did. She typed back, "Why does he want to meet with me specifically?" Falk's response came in under a minute. "His attorney says he wants to make a personal statement. We think he's trying to assess your testimony scope before tomorrow's briefing. We strongly advise against the meeting." She put her phone away. "Walsh." "Yeah." If Sloan's attorneys are trying to assess witness scope the night before a federal press briefing, what does that mean? Walsh's expression went still in the specific way she'd come to recognize as his version of paying very close attention. It means they think there's a disclosure risk in the testimony they don't have full visibility on. Something in my statement they don't know is there. Or something they're not sure is there. They're fishing. He paused. What's in your statement that Sloan wouldn't know about? She thought. She'd told Ito everything she'd seen and heard. The pharmacy, the basement, the corridor. She described the conversation she'd overheard between Voss and Marcus, the Kellerton shipment timeline, the reference to the DoD audit schedule being moved up. The DoD audit schedule. The overheard conversation, she said slowly. When I was in the basement, Voss and Marcus talked about the DoD audit schedule being moved up. That's why they were accelerating the timeline. That detail is in my statement. Walsh went very still. The DoD audit schedule being moved up, he said carefully, is not public information. It wouldn't appear in any of Sloan's operational documentation because it's not something Meridian would have known through legitimate channels. He paused. Which means if Voss knew, he had an information source inside the Department of Defense. The room went quiet. Outside, through the window, the parking lot lights had come on in the early evening dark. The hospital sounds continued around them. The distant call light, the PA system, the specific hum of a building doing its work. Everything exactly as it had been the night before. That changes things, Megan said. It changes a lot of things. Walsh's jaw was set. Falk needs to hear that specific piece. I put it in the statement. Did Ito flag it? She thought back through 2 hours and 20 minutes of methodical questioning. Ito had asked her to describe the overheard conversation 3 times. He'd gone over the Kellerton shipment detail, the Thursday timeline, the Marcus identification. He had not specifically asked a follow-up question about the audit schedule reference. I don't know if he flagged it, she said. It's in the recording. Call Falk right now. Walsh was already reaching for the room phone, habit overriding the fact that he'd been admitted without his own device. That one detail. If Voss had an inside source in the DoD, Sloan would know it, and that's the piece of testimony he's most afraid of. That's why he wants to talk to you tonight, before the briefing, before Falk's team has time to run the audit schedule thread. Megan pulled out her phone and called Falk directly. It rang twice. Calloway. The DoD audit schedule, Megan said. The overheard conversation. Voss said the schedule had been moved up, and that was why the Kellerton shipment was accelerating. That's in my statement. Did Ito flag it? A pause. Longer than Falk's usual pauses. Hold on, Falk said. Megan heard background sound. Movement. Someone being spoken to in a low voice. A door. She looked at Walsh. He was watching her face. Calloway. Falk's voice when she came back was different, tighter. That detail. We're running it right now. The audit schedule adjustment was a classified internal DoD memo distributed to a list of 11 people 2 weeks ago. Voss should not have known it had moved. But he did? Yes. Another pause. We're going to need you back in for a supplemental statement tonight. I'm at the hospital. Stay there. Ito will come to you. A beat. The Sloan meeting request? Decline it. Do not meet with him or his representatives under any circumstances before the supplemental is complete. Understood. She ended the call. Walsh was watching her with the expression of someone doing math and getting answers he doesn't like. How many people had access to that classified memo? 11, according to Falk. 11 people who knew the audit moved up. He stopped. And Voss found out, which means one of those 11 told him. Walsh's voice was very flat. Or is him. The implications arrange themselves in the space between them with the specific weight of things that are very large and cannot be taken back once fully understood. An 11-person list, a classified memo, a pharmaceutical fraud operation that had been running for 3 years inside federal contract structures, staying just far enough ahead of audits to avoid discovery. Not luck. Information. Sloan owns the holding company, Megan said. He has federal contracts. Federal contracts require federal liaisons, Walsh said. Someone on that 11-person list managed the contract relationship. Her phone buzzed. Not Falk this time. A number she didn't recognize. Local area code, different from the morning's calls. She looked at it. Something about the number was familiar in a way she couldn't immediately place. She answered, "Nurse Calloway." The voice was Sloane's. Calm, even, the executive frequency entirely intact despite everything that had happened since this morning. "I know Deputy Inspector Falk advised you against this call. I'm making it anyway, which probably tells you something." "It tells me your attorney advised you against it too," she said. "And you made it anyway, which tells me you're not thinking clearly." A short silence. "I'd like to explain some things to you, before tomorrow." "Mr. Sloane," she said, "I'm going to end this call, and then I'm going to tell Falk you made it, and then that's going to appear in a supplemental record that your attorney is going to find very inconvenient." She paused. "Unless you have something specific to say that would be better said to a federal recorder, in which case that can also be arranged." Another silence, longer. And in the length of it, she heard something she hadn't expected. Not the controlled management of a man working an angle, but something that sounded much more like a person who has looked at where they are and made a specific calculation about what comes next. "The 11 names on the memo," Sloane said. "One of them is going to be familiar to you." The line went quiet. Not dead. She could still hear him breathing, but quiet in the way of someone who has said the one thing they came to say and is waiting to see what it does. Her hand on the phone was very steady. "Who?" she said. Sloane said a name. Megan didn't recognize it. That was the first thing. The name landed and produced nothing. No face, no context, no connection to anything she'd encountered in 16 hours inside this building, or 14 months forward deployed, or 3 years at Stonebridge Memorial. Just a name, clean and unfamiliar. "I don't know who that is," she said. "No," Sloane said. "You wouldn't, but Falk does. And when she runs it, she's going to find that the connection between that name and this hospital predates Meridian by 6 years. He paused. "I'm not asking you to protect me, Ms. Calloway. I'm past that. I'm telling you that what you think you found tonight is not the complete picture, and if Falk moves on the 11 names without understanding the full structure, the person at the top of it walks away. Then tell Falk. I am telling Falk. Through every channel my attorneys will allow, but she needs corroboration from a witness whose credibility is not currently compromised by a federal fraud indictment." Another pause. "That's you." Megan looked at Walsh across the room. I was reading her face, the specific attention of someone who can't hear both sides of a call and is working from the half he has. "Give me the name again," she said. Sloane repeated it. She committed it to memory the way she'd been trained to commit things to memory, attached to a physical sensation, a specific point of pressure behind her left eye, a technique she'd learned in the Army from a woman who said memory without a hook was just noise. "I'm ending this call," she said. "I'm going to give this to Falk. What happens after that is not something I control." "I know," Sloane said. And then, in a register completely unlike the executive frequency, "I built something I didn't fully understand. By the time I understood it, I was too far in to see the exit." He stopped. "That's not an excuse. I just wanted to say it to someone who would hear it correctly." She thought about what it cost him to say that, and whether it mattered that it cost him something, and decided that it did and it didn't, and she didn't have the bandwidth right now to fully sort which. "I hear it," she said, and ended the call. She looked at Walsh. "Sloane just gave me a name. He says it's the source inside the DOD. Someone on the 11-person memo list with a 6-year connection to this hospital." Walsh went very still. "Did you get it?" "I have it. Call Falk." She was already dialing. Falk answered in one ring. Megan gave her the name and the precise language Sloane had used. "Predates Meridian by 6 years, connection to this hospital," and was quiet while Falk was quiet. And in the quiet on the other end of the line, she heard the specific sound of controlled urgency, which was the sound Falk made when something had just landed that she hadn't been expecting. "Where did you get this?" Falk said. "Sloane called me directly. I know you told me not to take the meeting." "This wasn't a meeting." "No, it was a phone call I didn't initiate." A beat. "Stay on the floor. Ito is 12 minutes out." She ended the call and sat back in the chair at Walsh's bedside and felt the last of the adrenaline finish metabolizing, leaving behind something that was quieter and heavier and harder to name. She was tired in a way that had texture, not just the physical exhaustion of 20-plus hours awake, but the specific tiredness of someone who has been carrying a weight that was too large for one person and has just set it down and can now feel exactly how much it was. Walsh was watching her with the expression she'd seen on him intermittently since last night. Not soft exactly, but open in the way that people sometimes got when they'd been in difficult situations together, and the situation was over, and the pretense of not having been through it together was no longer available. "You should sleep," he said. "Ito's coming." "After Ito." "After Ito," she agreed. Ito arrived in 11 minutes, not 12. He was a careful man who was also fast when fast was what the situation required, and the combination was useful. He sat across from Megan in the family waiting area, the same room that had been the field interview space all day, now cleared of agents and equipment and returned to its original function, which was a room for people to sit in when they were waiting for news, and recorded her supplemental account, which took 40 minutes and covered the Sloan call in precise detail and the name he'd given her and the context he'd provided. When the recording clicked off, Ito capped his pen and was quiet for a moment. "That's going to open a significant secondary inquiry," he said. "I know. You understand that secondary inquiry may extend the timeline of the primary case. I understand that whoever is at the top of the structure needs to be in the indictment, or the indictment is incomplete." She looked at him steadily. "If it takes longer to do it right, it takes longer." Ito looked at her with the appraising expression she'd been receiving from federal agents all day, which she was starting to find less uncomfortable and more simply accurate. "You sound like someone who's done this before." "I testified in a military medical review in 2017. The review took 8 months, the outcome was the right one, and the 8 months were not pleasant. I'm familiar with the timeline." He nodded, picked up his recorder. "We'll be in touch. Expect contact within 48 hours on the supplemental." He left. She sat in the family waiting room for another 3 minutes, in the specific chair that faced the window, and looked at the parking lot lights and the October dark beyond them and let herself do nothing, which was harder than it sounded after 22 hours of doing something. Then she went back to check on Walsh one more time, found him asleep, the real sleep of someone whose fever had finally dropped below 100, the body finally catching up, and left without waking him. She drove home at 10:40 p.m. and was asleep by 11. But the federal press briefing happened at 9 a.m. the following morning. She watched it on her phone from her kitchen table with the second cup of coffee she'd made, still in the clothes she'd slept in. The DOJ spokesperson was precise and factual and used language that was deliberately stripped of drama because the facts themselves were dramatic enough without assistance. 17 hospital contracts, 6 states, 3 years of operation, 11 months of documentation recovered from the Stonebridge sub-basement facility. 4 individuals taken into federal custody: Richard Voss, Marcus DeVere, and 2 distribution coordinators whose names she didn't know. Gareth Sloan, described as a person of significant interest, was cooperating with investigators. The spokesperson referenced clinical staff at Stonebridge Memorial, whose observations had precipitated the inside confirmation of the operation. No name? No detail beyond that single phrase. Her phone had been buzzing since 9:15 with messages from people who had seen the briefing and made the connection: colleagues, a former Army acquaintance she hadn't spoken to in 2 years, Paula, twice. She read them and didn't respond to most of them because she didn't have language yet for what people wanted to say to her, and she wasn't sure the language existed. Paula's second message just said, "ICU 7 is asking for you." She put her coffee down and got dressed. The next 3 weeks were not tidy. That was the thing nobody told you about the aftermath of something like this. It didn't resolve cleanly, didn't fold up into a satisfying conclusion and put itself away. It spread. It generated paperwork and depositions and phone calls from attorneys she'd never met, representing people she'd barely encountered, all trying to locate the edges of what she knew and how she knew it. The State Medical Board opened an independent review of Stonebridge's clinical practices. The hospital's parent health system put out 3 separate press statements in 8 days, each one more carefully worded than the last. Sloan's cooperation with federal investigators became a negotiated process that took 5 weeks and involved a legal team that was extremely good at their job, which meant that what might have taken 10 days took considerably longer. Dr. Alderman resigned 11 days after the briefing. The resignation letter, which became public through a records request 3 weeks later, was 2 paragraphs. The first thanking the hospital for the opportunity, the second containing nothing that meant anything. He did not face criminal charges. He lost his clinical directorship and his administrative standing, and the state medical board suspended his attending privileges pending a conduct review that was projected to take 6 months. Whether he'd known the full scope of the operation or simply looked away from the parts that were visible was a question that the review would take a position on and that she would probably never fully know the answer to. She thought about it sometimes. The specific quality of looking away from something you can see well enough to describe. She'd seen enough of it, in the army, in hospitals, in herself on smaller occasions she was not proud of, to know it wasn't always cowardice. Sometimes it was exhaustion. Sometimes it was the arithmetic of self-preservation done by someone who had too many other things to lose. That understanding didn't make it acceptable. It just made it human, which was a separate category. Price's cooperation agreement was finalized in the second week. He testified in a sealed preliminary hearing that Falk told her, very briefly and without specifics, had significantly strengthened the evidentiary chain against the manufacturing facility in Kellerton. The sealed nature of the hearing meant she didn't know what he'd said, only that it mattered. She thought about the man in the white coat in the corridor who had given her contradictory directions and ended his phone call the moment Voss appeared, and thought that what he'd done, carrying both roles for 6 months under that kind of sustained pressure, was something that deserved acknowledgement, even from someone who'd been used as a relay without being told. She didn't reach out to him. She didn't know what she'd say, and she thought probably he didn't need anything from her that she was in a position to give. Walsh was discharged on day 9. His shoulder infection had responded fully to the corrected antibiotic protocol by day 4, which confirmed what the medical liaison's independent review had documented. The compromised dosing he'd been receiving hadn't been inert, but it had been insufficient for his presentation, and the shoulder had been getting incrementally worse across the 3 hospital visits before this one, not better. The correct treatment produced results in 72 hours that 3 months of inadequate treatment had not. He came to find her before he left. She was in the medication room on the 4th floor, the same one she'd been in when Burrell delivered Voss's administrative notice 3 weeks earlier, checking lot documentation on a new shipment from a verified supplier. The kind of checking she'd always done, that she would apparently always do, that now felt less like excessive caution and more like simply part of the job. "They're discharging me," he said from the doorway. "I know, Lori updated the chart this morning." He looked better than he had the first night, not fully recovered, the shoulder still moving carefully, the residual fatigue of someone whose body had been fighting a serious infection for longer than it should have, but better in the specific way of someone who has gotten what they actually needed after a long time of getting something that wasn't quite it. "The name Sloan gave you," he said. "Did Falk ever loop you in on where that went?" "She told me the secondary inquiry is open and active. That's all she said." "That's all she'll say until it closes." He leaned against the doorframe. "I was in civilian clothes, jeans, a gray Henley, the kind of generic clothes of someone who travels light. It's going to close correctly. I can tell you that much." "How?" "Because the server room documentation covers 6 years of batch records, distribution logs, and financial transfers. Whoever is at the top of the structure is in those records. Sloan's cooperation fills the gaps that the records leave. It doesn't matter how clean the corporate layering looks on paper when the paper and the cooperation are pointing at the same person." She set down the lot documentation. "It bothers you that it's taking this long." "It always bothers me when things take this long." He said it without self-pity, just as a fact of his particular existence. "But Falk is good. Her team is good. It'll hold." She believed him. Not because she was in the habit of taking people's word for things, but because she'd watched Falk work for 3 weeks and had formed her own assessment, which aligned with his. "Take care of the shoulder," she said. "That's the plan." He straightened from the doorframe. "Calloway, I want to say something and I want to say it right, so tell me if I don't." She waited. What happened here, the way it happened, required someone to make about 14 decisions in a single night under conditions where every one of those decisions could have ended her career, and to make them correctly. He paused. "I've been in situations that required that kind of thing. I know what it actually costs, in the moment and after. I know it wasn't easy, and I know it didn't feel heroic. It just felt like the next thing that needed doing." He met her eyes. "That's the best kind of right thing. The kind you do because the alternative is unacceptable, not because you expect to be recognized for it. She held his gaze. You're better at the formal version of this than I expected. I've had practice. A slight dry shift in his expression. Terrible practice. I'm still not good at it. You're fine, she said. He extended his hand. She shook it. Take care of yourself, he said. You too, Walsh. He left. She picked up the lot documentation and finished the check and filed it correctly, and went back to her rounds, which was the thing she did and would keep doing. 6 weeks after the night that had started with a pager buzz and a patient who grabbed doctors by the collar and asked for a night shift nurse. Nobody thought much of. Megan Calloway sat across from the newly appointed interim chief of clinical operations at Stonebridge Memorial, a woman named Dr. Rena Ferris, who had come in from outside the health system specifically to oversee the transition period, which was the institutional word for the complicated process of rebuilding a hospital's operational integrity after it had been used as the hub of a federal fraud network. Ferris had a direct manner that Megan respected and an obvious intelligence that she found immediately useful. The meeting had been requested by Ferris, not Megan, which was relevant. I want to be straightforward with you, Ferris said. The hospital is in the process of redesigning its pharmaceutical supply chain oversight protocols. We're mandating an independent clinical verification layer at the nursing level, essentially formalizing what you did, except as a permanent structural feature rather than a single act of individual judgment. Mandatory nursing level verification on incoming pharmaceutical lots, Megan said, with documentation requirements, escalation protocols, and direct reporting lines that bypass administrative management. It prevents the kind of pressure channel that was used here. Ferris held her gaze. I want you to help design it. Megan looked at the surface of the conference table for a moment. She thought about what it meant to be asked to formalize the thing you did because it was the only option available, to build it into the structure of a place so that the next person who saw something didn't have to do it alone in a basement at 3 a.m. That's a significant project, she said. It is. It would require a partial shift in your role. You'd keep patient care responsibilities. I understand that's non-negotiable. It's non-negotiable, Megan confirmed. But you'd also lead the protocol development team, which includes pharmacy staff, clinical administration, and an external compliance consultant. Ferris paused. I'm not offering you this because of what happened. I'm offering you this because the person who designed that response in real time, with no resources and no authority and no backup, is exactly the person who should be designing the system that makes it unnecessary. Megan sat with that. She thought about what it felt like to be in the basement with her cheek on the cold floor because there was no other way to see what needed to be seen. She thought about Walsh saying the only one who looked at the patient. She thought about Paula's nephew and his VA prescription and the 16 patients who had gone home from 3 previous hospital visits still sick because the medication that was supposed to help them hadn't been what the label claimed. When do you need an answer? She said. I'd like one before the end of the week. You'll have it tomorrow, Megan said. Yes. The formal resolution of the Stonebridge case came in 2 phases. The first phase was the criminal indictment, handed down 51 days after the federal warrant. Richard Voss was charged on 9 counts, including federal healthcare fraud, conspiracy to defraud the United States government, and knowing introduction of misbranded pharmaceutical products into interstate commerce. Marcus DeVere faced 11 counts, the additional 2 relating to his role in the distribution network's physical operations. Gareth Sloan was charged on 7 counts, with his cooperation agreement reducing his exposure but not eliminating it, a distinction his attorneys had apparently understood from the beginning was the best available outcome. The name Sloan had given Megan over the phone, the name she'd committed to memory with pressure behind her left eye, the name she'd given to Falk, the secondary inquiry that had taken 6 weeks, resolved in the second phase. A senior contracting officer in the Federal Medical Logistics Division, who had managed the DoD relationships with the Meridian-connected hospital network for 4 years, was indicted on separate counts of unauthorized disclosure of classified procurement information and conspiracy. The connection to Stonebridge predated Meridian by 6 years, exactly as Sloan had said, a relationship that had begun as legitimate contract management and had been gradually, incrementally converted into something else by people who understood exactly how to convert things gradually and incrementally so that no single moment looked like the moment the line was crossed. The indictments were announced in a federal press briefing that Megan watched on her lunch break from the office that had been assigned to the Protocol Development Project, which was a small room on the second floor with a window that looked out over the parking structure and a whiteboard that she'd already covered with a structural diagram of the new verification system. The DOJ spokesperson named all 4 defendants. The spokesperson referenced the clinical staff at Stonebridge Memorial, whose inside observations had been critical to the case, and this time included a name. Hers. She watched her name appear in the closed captioning at the bottom of the screen and felt nothing dramatic about it. Not vindication, not triumph, just the quiet recognition of something being said in public that had been true all along. Paula knocked on the open office door. She was still on the 4th floor, still at the nurse's station, still doing the specific work of keeping a floor running that required the kind of durability most people didn't have. "They said your name," Paula said. "I saw. My nephew called me this morning." Paula leaned in the doorway. "He saw the news last week about the Kellerton facility. He wants to know if his prescription records from the past year are going to be reviewed." "They should be. Anyone who was treated at a Meridian-contracted facility in the past 3 years should have their records reviewed. Tell him to contact the VA Patient Advocacy Office and ask for a pharmaceutical outcome review. There's a federal hotline now. It was set up 2 weeks ago. I can give you the number." Paula looked at her. "You already have the number memorized." "I looked it up when the hotline was announced." Paula made a sound that wasn't quite a laugh. "Of course you did." She straightened from the doorframe. "Good press briefing." "It was all right. Your name sounded fine when they said it." "Paula." "I'm going back to the floor," Paula said, and went. Bob. 3 months after that night. 4 months and 6 days after the pager buzz that had started all of it. Megan Calloway stood at the front of a conference room at a federal medical oversight symposium in a city 2 hours from Harlow and gave a 20-minute presentation on the nursing-level pharmaceutical verification protocol she'd designed for Stonebridge Memorial. She was not a practiced public speaker. She'd asked Ferris, twice, whether someone with more experience should be doing this, and Ferris had said twice that experience in public speaking was not the relevant qualification, and that the relevant qualification was understanding exactly what the protocol was and why it was designed the way it was, and that Megan was the only person in the building with both. So she stood at the front of a room of clinical administrators, compliance officers, and federal healthcare oversight staff, and she talked about the verification system with the same directness she'd used in Walsh's room at 3 in the morning. She talked about what the absence of the system had looked like, not as a story, not with the drama that the story could have been given, just as a clinical gap that had been exploited because it existed, the way all gaps are exploited when someone with the motivation and the access decides to exploit them. She talked about the structural features that made the new protocol resistant to the same kind of administrative pressure that had been applied to her personally. She talked about the documentation chain and the escalation pathway and the specific role of nursing-level oversight in pharmaceutical systems that had historically excluded nursing input. When she finished, a man in the 3rd row raised his hand. "Ms. Calloway, the incident at Stonebridge, when you identified the irregularity and pursued it through the administrative structure, you had no authority to do what you did, no protocol, no formal backing. What made you keep going when you could have stopped?" She thought about how to answer that. She thought about the right answer, which was probably something about systemic accountability and clinical obligation and the duty of care. She thought about the true answer, which was different. "I had a patient," she said, "and his medication wasn't right. Everything after that was just the next thing that needed doing." The man in the 3rd row wrote something down. She drove back to Harlow in the early evening, the flat landscape going dark around the highway, the radio on low. She wasn't thinking about the presentation or the case or the protocol. She was thinking about the shift she had tomorrow. Not the office work, not the development project, the floor shift, the ICU rotation she'd kept because Ferris had said it was non-negotiable, and she'd meant it. She was thinking about the patients. That was the thing she'd come back to, over and over, across 4 months of depositions and press briefings, and protocol development and public acknowledgement of a name that had been invisible for 3 years of night shifts. The patients were still there. They were always going to be there. The next one and the one after that, lying in beds with monitors and IV lines and whatever was going on inside them that required someone to pay attention. The attention was the job. It had always been the job. She thought about something she hadn't let herself think about directly until now, because during the period of active crisis there hadn't been space for it. And after the crisis there had been too many other immediate things. She thought about what it cost to be the person who looked when everyone else was looking at the clipboard. Not the dramatic cost, the depositions, the administrative review hold, the attorneys, but the quieter cost, the one that doesn't make press briefings. The cost of knowing, once you've done it, that you will always do it again, that the next time something is wrong, you will not be able to walk past it, that the choice you made is not a one-time thing, but a permanent feature of who you are now, if you weren't already. She thought about whether that was a burden or a definition. She decided it was both, and that both was fine. The highway lights came on as the dark completed itself. She drove through them, each one briefly lighting the interior of the car, and then gone, a steady rhythm of illumination across the flat October country. There was a shift starting at 7 a.m. There were patients who would need things checked and lines adjusted and monitors read, and the particular quality of attention that couldn't be automated or delegated or replaced by a better system, however good the system. There was a protocol that was going to spend the next 6 months being refined and tested and argued over and made more robust by the arguing. There were 17 hospitals across 6 states whose supply chains were now subject to independent review, and there were patients in those hospitals who were getting the medication they were supposed to be getting, and there were others who had already received clinical reviews that had caught things that would have continued to go uncaught. None of it was clean. None of it was finished. The secondary inquiry was still open. The trials were going to take time. The protocol was going to be imperfect in its first iteration and would need to be fixed and would be fixed and would probably develop new imperfections that required further fixing, because that was how systems worked. Not through perfection, but through continuous correction by people paying enough attention to notice when something was wrong. That was the job. It had always been the job. Megan Calloway drove toward Harlow in the dark, thinking about tomorrow's shift, and the job felt exactly the size it was, large and specific and hers. Not because anyone had given it to her, because she had never been willing to put it